Hi everyone. Thank you so much for joining us here today. A very quick introduction, though I think you have been using Tata1mg services for quite a long time, and we are really thankful for you for putting your trust in us. And today we are here to introduce the very first chapter of our flagship event called Healthcast. And this particular chapter is called Diabetes Talk Show. We as Tata1mg have been researching and putting our best efforts in the field of diabetes and endocrine disorders from quite a long time. It goes back to 2018. And now we are here with this event. A very short brief, what does Tata1mg do? We are India's largest digital healthcare platform. We cater to e-pharmacy requirements. We have e-consultation. And now we also have our own diagnostic services. And of course, we are known for our expert, vetted, relevant, and evidence-driven medical content. I am Dr. Swati Mishra. I am your host for the day. I take care of the patient support initiatives, and I work very closely with our technology team to build and improvise the condition management programs which we keep building for our users. And thank you for joining us here. Now, I just want to quickly introduce our expert panel. We have quite a comprehensive panel here. And this is for the specialty and the USP of this talk show, that we are going to cover multiple aspects and multiple pillars of diabetes management. The overall intent and the idea of this talk show is to have an expert-led conversational event wherein you get to ask your questions and we cover the very important and crucial aspects of diabetes management holistically. So that's the idea. A very short brief, and then I'll just take over to the main part of it. Today we have Chavi, our diabetes educator. We have Dr. Paras, our diabetologist. Dr. Rajiv Gupta, again a senior consultant diabetology. Dr. Rajiv Sharma, VP Medical Affairs, Tata1mg. Dr. Meghla Chandra, our weight management consultant. And we have Atika Dandia, who is our wellness and yoga expert. We have Dr. Shalini, who is a vitreoretinal surgeon, and she's currently working with Shaw Eye Center. We'll know more about their expertise and how they are here to help us. But before beginning the talk show, I would just like to take a minute and introduce our chief guest for the day, Dr. Rajiv Gupta. Thank you so much, sir, for joining us in here. I just wanted to,
It's my pleasure to be here and sharing whatever insights we have with the people present here.
I just wanted to share a quick brief for our audiences as well. Many of you would already be knowing about Dr. Rajiv, but I just wanted to share a quick reminder. So Dr. Rajiv Gupta is a senior consultant in internal medicine and diabetology, and he has an extensive experience in the field of diabetology spanning over 40 years. He completed his medical education from Maulana Azad Medical College and Dr. Ram Manohar Lohia Hospital, and he also did postgraduate diploma from Johns Hopkins University, US, and he also pursued further education and he also has a specialty course from International Diabetes Federation. He has been associated with various top hospitals, including CK Birla, Fortis, Max Super Specialty Hospitals, and currently he has his own practice and his personal clinic called Upchar Wellness near Gurgaon. An active researcher and an academic enthusiast, he has numerous publications to his name, and he has conducted various continuing medical education, what we call CMEs, for doctors and practitioners who are keen about knowing more and more about diabetology and other aspects of clinical cardiology. I can go on and on if I continue speaking about sir, so I'll just take a pause here and just adding another feather in his crown. Recently, Dr. Rajiv also launched a book in the New Delhi World Book Fair 2023 that's called Stress and Diabetes, an Underappreciated Connection. And it's a very untouched area which maybe many of us wouldn't even given a thought to. So with this, I would just like to pass the I would just want to hand over the stage to you, sir. Over to you. Maybe if you can just cover a little about stress and diabetes, and also share a few thoughts about your book and how you arrived to this concept.
Thank you, Swati, a lot for such kind words. So, during the course of my professional career, we noticed over the years that despite the best of efforts from the patients in terms of their lifestyle management, the patient who has diabetes has to take almost 100 decisions in one day. क्या खाना है, क्या नहीं खाना, ये नहीं खाना, इतने बजे एक्सरसाइज के लिए जाना है, दवाई लेनी है, शुगर चेक करनी है, डॉक्टर के पास जाना है, लैब टेस्ट करना है. He is totally overwhelmed, and this thing is being called as a diabetes distress. That is the distress which is imposed by a chronically managing a chronic disease 24/7. So all these factors are there, which if addressed, they will result in a better control of diabetes, in more relaxation for the patient, as well as in better outcomes in terms of a glycemic control, their blood glucose control, as well as prevention of complications. Patients ask me, so there's a tendency to go into guilt. Now, guilt, somebody has had a dine out, say on a Saturday or a Sunday. The next day, I get the message, my blood sugar is 150. Then tell them, okay, it's fine. There is no problem in deviation once in a while, because the prognosis as per the current information depends upon the HbA1c. HbA1c is an average. So the average, it is what it determines as of now. Yes, the fluctuation should not be too much, because glycemic variability, as they call it, too much fluctuation, that itself is harmful. But once in a while it is not, so you don't have to start taking guilt about yourself. Obviously, you should not persist with such a habit day in and day out. But once in a while, it's okay. Similarly, about blood sugars. Now, 3 or 4 times a person is on insulin, he has to prick himself or herself for insulin. Then he has to prick for checking blood sugar. So we can make the patient relaxed. You may not do it every time. You may do it say, twice a day, or we may focus on those blood sugars which are tend to be high, and we can manage them. So in this way, we try to relax the patient so as to get a better outcome, and that helps in building up the adherence to the treatment. Because if stress is there, the stress gives rise to other unhealthy behaviors, lack of exercise, not adhering to the dietary plans, not adhering to doctor's visits. So it turns a vicious cycle. Stress versus diabetes leads to complications, then it adds further to the stress. So this is the way things go on, and we have to break this cycle, getting the patient's confidence, encourage them where they are doing good. Once in a while deviation doesn't matter, and usage of techniques like yoga, mindfulness, and if you find that some things are going on beyond one's control, and the primary care provider, for example me, if I feel myself unable to convince the patient or deliver the patient the messages, probably we might require the support of a mental health professional in the form of a psychotherapist or a psychiatrist. So these all things prompted me to write the book, and the book doesn't talk about anything about medicines, it just talks about behavior, and to look into the insight of how the patients feel about their stresses and how they can be mitigated to the best extent as possible.
Great to know that, and great insights, sir. So if you have any questions, I know we have questions pouring in onto our online channels. And Monali, if you can just take a printout, because I won't have access, I'll just check it out here as well. So, but just in case you have any questions directed to Dr. Rajiv, we can just take a pause, hear you out, and then move ahead. Okay, Monali, do you want to cover something from in here?
I think we'll keep the questions towards the end.
What do you want to? So someone's asked on, can diabetic patients be cured by Ayurvedic medicine, or if not taking insulin?
Okay.
Right.
Yeah.
See, as per our medical ethics regulations of Medical Council of India, we who practice allopathic medicines are not allowed to practice what is called cross-pathing. So, at this juncture, it will not be appropriate for me to say anything about whether Ayurvedic helps or not. One. Secondly, I am not trained in Ayurvedic. Third, I am trained in the system of medicine which I am trained in. It is based on evidence-based medicine, on scientific principles. By which means I do not deny that another system of medicine is not scientific. So it would be an inappropriate platform to even answer to this question in either yes or no.
Thank you, sir. I think we can move on. I think they were answered.
I spoke to a few friends earlier who also got to know about your book. So, and I remember one of the questions, it just currently triggered me. So one of my friend asked that so she has a strong family history of diabetes, and she was diagnosed with pre-diabetes at 26. And she was just thinking because these days all of the youngsters and all of the young people, they are very career driven. So she was like, should I take maybe should I just go on a break, relax myself, and come back? How is pre-diabetes and stress correlated?
So a person with pre-diabetes, so there are three pathways which it can take. It can remain in the same as the pre-diabetes one. It can normalize to non-diabetes, so it can normalize to normal A1C levels, or it can progress to diabetes. Now, the fundamental principle of prevention of progression from pre-diabetes to diabetes is lifestyle, which was demonstrated in a long-term study which is called the Diabetes Prevention Program somewhere in 2001, wherein they showed that people who were pre-diabetes and had enrolled themselves in a program of lifestyle from exercise, structured exercise program as well as dietary management. There was almost, I think, 37 to 40% reduction in progression from pre-diabetes to diabetes.
Now, I think we can just move forward to the second part of the primary part of our talk show, wherein we have a couple of questions that we received from multiple folks whom we reached out to. So we have you, and we have 1 crore people whom we reached out through our newsletters, and they have shown interest that they would want to know more about particular topics. I have all those questions in here in association with what our experts think are pertinent for all of you to know and be aware about. Apart from that, we also have close to 7,000 people joined us on our YouTube channel, and the social media numbers are still adding up. With this, I would just like to move on to the next section and a very, very quick introduction of our other panelists. I just shared the names, but I would just also like to take a minute to introduce them in a little detail. So, Dr. Paras, I will just briefly start with you because and I'm just following the order in which we'll pass on the questions and cover a particular theme. So, there's no fixed sequence or a chronological sequence. Just that. So, Dr. Paras is a senior consultant in clinical diabetology. He did his medical education from MAMC. He also did his PG diploma in clinical endocrinology and diabetes from Royal College of Physicians, UK. And he also has a fellowship in advanced diabetology and endocrinology. He has been associated with Max Super Specialty Hospital. He has authored more than 15 papers in reputed national and international journals, and he's currently also practicing near Gurgaon in Sector 15. Thank you so much, Dr. Paras, for joining us in here. I'll just quickly introduce all our other panelists and come back to you with the specific questions. Dr. Shalini Singh, next up is Dr. Shalini Singh. So Dr. Shalini is a vitreoretinal surgeon, and she's currently associated with Dr. Shroff, Charity Eye Center, New Delhi. She completed her medical education from Nagpur, Mumbai. She also continued to pursue her specialty medicine and specialty education from the very prestigious Sankara Nethralaya, Chennai. She is passionately involved in the crusade against the prevention of diabetic retinopathy, its prematurity and its prevention. And like you have been informed, Dr. Shalini has also obliged us with arranging and scheduling a free retina eye examination for all our participants. Those who will not be able to make use of this facility and this services right here, we'll be sending the details, how it is done, and the highlights of the program online to you, and we can connect for more details. Moving on to Dr. Rajiv. So Dr. Rajiv, he completed his medical education from Bangalore Medical Research and Center, and he's highly enthusiastic about patient safety and holistic patient care services. He's currently heading medical affairs at Tata1mg and leads all the clinical initiatives and patient support programs in here and Tata1mg. And just to add, he has a keen skill set, and also very passionate about building healthcare digital systems. So that's also his expertise. Dr. Meghla Chandra, we also have Dr. Meghla Chandra with us here. She's an MD internal medicine, and she did her fellowship in obesity from US and has been practicing in US for more than 10 years. She has recently joined 1mg as our weight management consultant, And just to share, Dr. Meghla, we recently launched a weight management and obesity management program in a few of our retail stores as well. So you can go check out and you can find Dr. Meghla all over our retail stores. We have Chavi. Thank you, Chavi, for joining us. Chavi is a senior nutritionist. Many of you, people who have joined us on YouTube, would have already met, known, and learn a lot from Chavi already about diet and diabetes. She's a senior nutritionist and a chief diabetes educator working with Medanta, the Medicity, Gurgaon. Okay. Next up, we have Atika Dandia. Atika is our wellness and yoga and meditation expert. Atika is also a very popular face on our YouTube digital medium, and our audience, Atika, I just want to add, our audience love your videos and they have also learned a lot from you. Atika has, just to add, Atika is also a transformational coach and a TEDx speaker. She has also been appointed by the Ministry of Tourism to promote yoga and meditation abroad outside India. And her main skills, and I think it's very, very important to know that she knows how to teach people to train their minds. So I think it's very important. She has trained more than, she has given more than 10,000 hours of training and just spread her expertise in 30 plus countries. With this, maybe we can just have a round of applause for all our panelists. Thank you so much, sir. Thank you everyone for joining us in here. With this, I'll just take, we can just move on to the main elements. I have, and Monali, I'm just requesting again. Okay, Ashin, I have you. I already have this question, but in case there are more questions pouring in, just let me. You can take the questions towards end of the session, but I just wanted to remind.
We'll collate all of them.
Dr. Paras, I can begin with you, and then we can also consider, and we can take Dr. Rajiv's take on a few of the questions, since he has already touched upon in his brief. So a very, very important aspect that we have noticed, people just live with diabetes. They don't understand what exactly is causing their diabetes. And that's where a few of our folks who have received this newsletter, and we also just wanted to quickly share, we also did a very detailed campaign, a series of journey around making diabetes manageable with close to 40,000 people. This was one of the most common query among it. Why does diabetes occur? And people are also asking, we have heard about type 1, 2. Briefly, can you briefly touch upon the type and tell more about why does type 2 happens?
So very valid question. So, we need to understand that diabetes per se, if you see the term, it was derived from a Greek word. So mellitus word is added. So it basically means where you are siphoning out or pushing out urine that is having glucose in that. That is a historical term. That is how it was picked up. Even if you see old literature, it has mention in it. So it's been there for a while, and now it's only with time that we are learning more and more about it. I mean, yet today the research is still on, and if you see, diabetes is the only disease where there is advances coming in every year. So mechanisms of diabetes, I guess we know so many, but there are still more to know. So diabetes happens as an interplay between lifestyle and genetic issues. Obviously, there is a genetic basis to most of the patients, but lifestyle has a major component associated with it. So of course, if you see here, as Dr. Rajiva said, historical textbook always mention that diabetes happens in the elderly, 40 and 50. But nowadays, there is a huge shift in the demography. We are seeing younger patients coming up with type 2 diabetes, which is the more common type of diabetes. I'll come to the difference between type and type 2 after this. So just understand what is diabetes, that in our body, anything that leads to our incapacity to handle the glucose load when we are eating anything, that is going to get broken down into smaller particles, that is glucose, that has to be handled and converted into energy at the level of the muscle. And there is a whole process from that. It begins from the stomach, the pancreas ropes in the hormones, insulin, and then it has to be utilized. If in the patient there is at any point inability to handle that glucose load, whether it is due to lack of insulin secretion, lack of insulin production, or let's say insulin action, to put it very in a simple term, that will lead to high blood glucose levels, which are obviously the levels which are set by God. If the levels are more than that, more than the normal that has been seen through studies, is going to be harmful to the body in the long run. There will be complications. And that is the whole purpose of treating diabetes, is not to show you some normal numbers on the glucometer, It's actually to prevent the complication from happening due to uncontrolled diabetes. So you may be having diabetes, but the question here is whether are you having controlled diabetes or uncontrolled diabetes. So a person who's having the controlled diabetes will have no problem if they are into a proper structured program, will live perhaps as long as they would have if they would not have diabetes, and the quality of life would be very good. If the diabetes is uncontrolled, that will lead to complications. Now, whenever a patient of diabetes comes to us in our clinics when they come, it is very important we should first, that's what doctors tend to do, we first tend to classify that which type of diabetes the patient is, because the treatment will be guided by them. Sometimes it's very clear, sometimes it's very clear, because now I'll come to the type of diabetes. There is a classical definition of type 1 diabetes, and then there is a type 2 diabetes. Type 1 diabetes was historically called insulin dependent diabetes, we don't use that term right now. And type 2 diabetes was called non-insulin dependent diabetes. These are the broad categories. In type 1 diabetes, what happens, which is not so common, about 4 to 5% of patients would have type 1 diabetes. In this, as I said, there will be no insulin production in the body. There is the major pathophysiology or major कारण जो diabetes का है वो है lack of insulin. Such patients definitely require insulin for survival, because this will be a typical patient of type 1 diabetes will be a small child. It will be like a stormy onset. You will see the child playing very well, and then suddenly the child falls sick, not well, vomiting, maybe some symptoms which are not losing weight, lot of urination, and they just present to the emergency, and the child is typically diagnosed with very high sugars, with ketone bodies present, and insulin is a lifesaver in this case. Mind you, there is no other alternative therapy as of now in terms of evidence-based therapy except insulin. So such people have survived now because insulin was discovered 100 years ago. So clearly, the insulin deficiency is the mainstay of diagnosis reason here. On the contrary, the more common type of diabetes, which we call as type 2 diabetes, which is about 95% of patients would be having. Okay, so let's say if we have about 420 million diabetics in the whole world and 80 million are approximately in India, 95% of them will be type 2. In this, in the initial stage, insulin deficiency is not there. That is not the major pathophysiology. Later on, it may happen, but there is a problem in the insulin action. तो आपके पास insulin की कमी नहीं है, but insulin या तो properly secrete नहीं होता है या वो अपना काम नहीं करता because of insulin resistance in the body. Such patients, if you see typically, as I said, in their most patients, the diagnosis is not very difficult. At the first visit, we are able to classify them as T2DM or a type 2 DM, which you will see on a doctor's note front top. They'll be very typically obese, overweight, and they would be having skin markers of insulin resistance, which we use. You may see a blackish kind of velvety skin on the neck, or maybe skin tags. They give indication that the insulin deficiency is not there, and you are having insulin resistance. As a result, your glucose levels are not handled by the body very well. So thus, the treatment in such patients is not typically insulin to begin with, unless there are special situations or the patient is very sick. It's always tablets or a lifestyle change, which is very, very important, which will help you modify that insulin resistance at that level. So these are the two classical types of diabetes. Yes, type 2 diabetes itself has multiple different mechanisms which we have learned now. There could be the secretion issue of the insulin, there could be at the level of kidney, there is some resistance or a reuptake issue. So different mechanisms have come in. And there is also a third type of diabetes, which is a special category that is called gestational diabetes. This happens to women who are pregnant during pregnancy because of the status of pregnancy. Typically, once the pregnancy is over, the sugars tend to come back to normal. But you have to remember that females who've had gestational diabetes, they are at future risk for type 2 diabetes because of the altered hormonal status, the sugars tend to become higher during pregnancy. And that's very important to handle for the safety of the both mother and child. And obviously, you will be guided and treated accordingly by your doctor. So as you said, there was a friend of yours who was asking, she is pre-diabetic at the age of 26. So I would like to add to that, she has to be careful because a 26-year-old female who is pre-diabetic probably would be moving on to a pregnancy in due course and time. And she would be at risk for gestational diabetes as well because she is theoretically at risk for type 2 diabetes. So this is the stage where she should be working on a diet and lifestyle. There will be no medication typically unless the risk factors are too much, and she should be able to reverse her pre-diabetes. So that's for future safety. So these are the two types of diabetes.
Okay, yeah, thank you so much. In fact, we keep conducting multiple surveys and filling out different questionnaires to figure out where exactly is the information gap. And just to point out, we also rolled out a survey to our cohort of people who seek pregnancy care services. And that's also one area. Gestational diabetes came as something which people wanted to know more about. Maybe we can come back to it a little later. Dr. Rajiv, over to you. So there is one more thing. People have read online that Indians are genetically prone to diabetes. What do you want to add? Is that true, myth?
Yeah, that's true, and especially they are prone to diabetes at a younger age. Because what is classically described as a phenotype, phenotype means the structure of the body. So, one is genotype, there is a genetic makeup, and is phenotype. So, there is what is called a typically thin fat Indian. There the periphery, which means the limbs, etc., they are thin, but there is intra-abdominal fat accumulation or intra-abdominal adiposity or visceral adiposity. So this creates a situation of insulin resistance and we become more prone to development of diabetes at an earlier age. Yes, we are definitely more prone and at a younger age. And perhaps there may be some genetic element also that has been, research has been done upon that, a lot of mutations or things are going on.
And maybe like our changing lifestyles and westernization of
Yeah,
lives is also
absolutely.
contributing.
Swati, a little louder, please.
Okay. I'll be louder. Okay, there was one more question which I think we have both Dr. Rajiv and Dr. Paras have already covered. Why are so many young people getting diabetes? Any other inputs, any additional thoughts you want to share on this particular? I think this is also one of the most commonly asked questions. Why are many young people getting diabetes?
It's something to be very worried about. But obviously, when we see the history of the patients who are presenting, I even have a type 2 diabetic patient who is just 19-year-old. It's very surprising. That's the youngest type 2 diabetic I have seen, but it's becoming more and more common. Now, if you see the history, obviously there is, as I said, there is an interplay of genes as well as the environment. So if you ask them, do they have a strong family history? Because diabetes itself is becoming so common in India, almost in I think urban cities, the prevalence is currently around 16 to 17% in the adults. You're living in a society, are you going for the walks and the parks that the society has built for you? Answer is no. What is it that you're eating? Quickly ordered through the app. Perhaps the most unhealthy thing that is eaten very commonly. Alcohol intake is slightly on a rise. Stress, smoking, all these factors, work-related stress are definitely perhaps triggering, and the stress, as Sir just mentioned about stress, there are underlying factors which are there, and stress could be the trigger of those which is leading to an early onset of diabetes, which is very unfortunate because, mind you, because the modern medicine will give you a good control and a survival, but there will be a huge long period that you will be living with diabetes. That is something which you need to understand. So we should try and delay this. We should, cause this demographic shift back to, or rather delay it as far as we can by focusing more on the young population. It's really unfortunate, but that's happening.
I understand, and in fact, I know where you're coming from because I also, in fact, many of us would agree that we just have our breakfast on the go. Hardly there's a time to just sit, relax, and mindfully eat. And Atika will share more about it, but I know. Okay, and just we have other questions too, but I just want to skip other questions and move on to a lesser talk thing. And while we are covering lifestyle risk factors, Dr. Rajiv, one of the user asked, how is sleep related to increased risk of diabetes?
Yeah, so sleep has got a profound relationship with diabetes. So there is a thing called, an entity called obstructive sleep apnea. Now, obstructive sleep apnea is a condition where there is a sleep disordered breathing. People go into sort of, they stop breathing during their sleep. And the predisposing factors of obstructive sleep apnea are obesity. Obesity is also a risk factor for diabetes. So somewhere there is a concordance that people who are having OSA, they are more predisposed to diabetes. So that is one thing through the mediation of the obstructive sleep apnea. Second, already somebody is having sleep insomnia, disturbance in sleep. So their adrenergic system or the autonomic nervous system that is already at a higher, reset at a higher level. So catecholamines are there and they are not able to sleep. Those chemical hormones they trigger biochemical changes inside the body and they become a trigger for precipitation of diabetes. So through sleep apnea and through stress.
Can we, just on a lighter note, can we expect a new book coming and you covering sleep and diabetes?
Yeah, see, it's an ocean actually. Every aspect of diabetes, because it is just in the society and everywhere. Every aspect needs further elaboration. And as one patient which I mentioned as a case study, He's so frustrated. क्या हो गया? मैं डॉक्टर के पास जाती हूँ, अच्छा शुगर बढ़ गई है, चलो ये दवाई बढ़ा दो, ये बढ़ा दो, फिर फाइनली इंसुलिन शुरू हो गया. अरे देखो तो सही ना, क्यों बढ़ी है? I mean, where the fault lies? Yes, the fault may be, I mean, the person is not adhering to the expected lifestyle, but then if he or she is not adhering, why is she not adhering? So one patient told me that the blood sugars were coming fairly under control. Then there were family circumstances कि मेरी mother-in-law को illness हो गई, फिर वो घर में आ गई, मेरा घर के सारा काम मेरे सर के ऊपर आ पड़ा, मेरा अपने पर ध्यान देने का टाइम ही नहीं था मेरे पास. मैंने तो अपने हस्बैंड को बोलो कि हेल्प अरेंज करें, कि आपकी भी तो लाइफ इंपॉर्टेंट है ना, आपकी जो बीमारी है वो भी इंपॉर्टेंट है. अगर आप अपना ध्यान नहीं दोगे, आप कैसे औरों की सेवा करोगे? सो इट्स everywhere. So family has got a very important role. Family, friends, but these are the things. So it's not just a biochemical disorder or a endocrinal disorder. So nowadays, in fact, the ADA, the American Diabetes Association, last year they said the slogan, "Diabetes is a behavioral disorder."
That's so true. Okay, with this, I'll just request your inputs on this, Dr. Paras. How important are our medicines to manage diabetes? Can I skip my medicines when I feel okay?
So any form of intervention to manage diabetes. First of all, you should understand that diabetes is a manageable disease. Please don't equate it with malaria, typhoid, and dengue fever that it's going to get over with just 7 days or 15 days of medicine. Yes, you may see results. You may see results that you presented with a 250 or 300 sugar to the OPD, and after 10-15 days when you were asked to monitor, you are getting the glucose values in normal range because of the medications that you started and the lifestyle diet changes that you did. But the decision to discontinue, reduce, or increase medicines should be guided by your treating physician or diabetes specialist, because temporarily they are the one who are having the knowledge of the disease where it's going to go. So do not judge your disease by what you're feeling, because trust me, 50% people, Dr. Rajiva would agree with me, 50% of patients who are having diabetes uncontrolled may not have any symptoms. So symptomatology is not the right judgment for this disease. Yes, there could be a time which would come there the doctor would consider reducing your medicines. Mind you, wherein you have met the doctor halfway on the bridge by doing your behavioral and lifestyle changes as well. And if that is a reality, trust me, medicines are something which will be given very judiciously by your doctor, only to the point where they are beneficial to you in the right doses. So do not self-medicate. And in fact, discontinuation of medication is also a type of self-medication, because that can lead to fluctuations and more anxiety later on. Please meet your doctor and let the doctor decide that for you. That will be better, because that can be very harmful.
So I fully agree with Dr. Paras. See, what happens is that people start equating the number of pills with the intensity or the severity of the illness. So when such a person says, "Doctor साहब मेरी तो sugar control चल रही है, दवाई बंद कर दूं मैं या कम कर दूं?" क्यों करनी है? Is it important to count the number of pills, or to have a better quality of life and better freedom from complications in the future? So that choice has to be. So as a doctor, we can only suggest, we can guide. The decision has to be the patient, because what is called nowadays, a lot of talk is being done about collaborative medical care or patient-centered approach. So, and as Dr. Saab said that, I mean, you take a decision on yourself. नहीं मेरी कम कर दी थी. There are clear-cut guidelines. If the person tends to go into low sugar or hypoglycemia, then you have to decipher as to what are the causes there. Is there something, probably the blood sugar is coming under control, and what we call the glucose toxicity that is being relieved. Now the requirement of medication is less, so they may go on a very slow process of, say, maybe de-escalation. With the caveat that the requirement of medicine may increase again. So again, education, explanation, education. That is very important.
In fact, I just want to call this out again. We have a very, very important message here, and I remember experiences from a few of our past initiatives wherein other diabetic people joined us, and for all the people who have joined us online, बिना अपने डॉक्टर से बात किए हुए अपनी मेडिसिन्स नहीं छोड़ें. You may feel okay on some days, but it's very, very important that you consult your doctor, discuss your health condition, that you are feeling okay, or how has this been going for a long, or maybe in recent weeks or months, and do not just stop your medicines abruptly. It can just take all the progress back to day zero. So just make sure that you're sticking to your medicines. It's very important. And interestingly, I was just exploring diabetieseducator.org. It's a very esteemed online resource. They had published one report, and it dates back to 2020, but it's not been too long, which mentioned about 30% diabetic people, they leave their medicines without consulting their doctors, and it was so unfortunate to read it. I mean, it's a chronic disorder. I think every one who has diabetes would have at least heard about the complications, if not in detail, but at least थोड़ा बहुत पता होता है कि यहाँ पे इफेक्ट होता है, किडनी में इफेक्ट होता है, ये चीजें पता होती हैं. Despite knowing those things, I mean, we just take a decision which is so medically important on ourselves. So it's a strict no. Okay.
At that point, I'd like to appreciate the role of digitalization of healthcare. Rajesh Sharma would agree. That is where digitalization of healthcare has really helped in terms of compliance. Patients who are utilizing those services, they would agree. They do get those digital reminders, and digitalization of health really helps you keep a track of the medicines that you're on. So it's something which can be taken benefit of, where the patients feel or the caregivers feel that compliance can become an issue. Sometimes it's a challenge. So where the digital health can really help. It's like a good reminder to stock up your medicines, or even reminder to meet the doctor. So that's really good.
In fact,
in USA, what they call is the DSME, Diabetes Self-Management and Education. And the diabetologists lobby, they persuaded the insurance companies to make reimbursement for them. Till now, the reimbursement was only for consults and for medications. I'm sure you agree with this. The DSME is a very important part, fundamental, but it's called the foundational for the management of diabetes, the first step.
We need such programs in here too. Dr. Rajiv, we have pill reminders, and we are doing our bit in just making sure that our set of users stick to their medicine. But I would come back to the medicine adherence part of it later to you. I just want to cover a few more important questions which we have received from people. Okay. So now we have, why is managing diabetes so important? I have it from last 15 years. Still, I am going on with it. Okay, so we have finally, we are heading what we were just discussing.
So why is diabetes?
Why is managing diabetes so important? And he's just mentioned that I've been a diabetic for last 15 years, but I still feel okay. So why it is so important to control your diabetes?
The importance is that there was a long-term study which is called the UKPDS. It showed that there is a legacy effect, इसको कहते हैं विरासत. First 5 to 7 years, 10 years में अगर कोई अच्छी तरह शुगर कंट्रोल करता है, उसको जो benefit है, it will be accrued for long term. So initial years are very important, and it was found that patients who did not have control earlier, so there is a bad memory and a good memory. Good memory means good control, delay or prevention of complications. Bad memory, earlier onset of complications. If you start becoming aware of the treatment of your diabetes once complication has already occurred, say some retinopathy or a nephropathy has occurred, then probably that won't be reversible. You have already lost half the game. Now it would be some effort to prevent the progression of that complication. That is number one. Second is there is called the microvascular complications which are specific to diabetes. Then there is the macrovascular complications which are basically cardiovascular disease, cerebrovascular disease, peripheral arterial disease. Again, if you don't control, they just keep on accumulating. They keep on contributing to the progression of the atherosclerosis. So when symptoms occur, it is already more than half the game is already lost. So it is important to maintain control because the condition is more or less asymptomatic. So you cannot, as Dr. Sabir said initially, you cannot correlate the presence of symptoms with the severity of diabetes, or you cannot undermine the importance of control of diabetes just because there are no symptoms.
Yeah. And Rick, now that we have touched upon the long-term complications, maybe you can just quickly, anyone of you can share that what are the most common complications that people with diabetes can suffer. I know Dr. Rajiv, you covered microvascular and macrovascular, but maybe at a broader level, in a little simple terms, because I'm sure there are many non-medicals.
So in diabetes, try to understand the whole trick is not just bring it in control now and then you're done with it. No, it's a chronic, insidious, slow disease which is going to stay with you for life. ठीक है? अगर आप सपोज के लिए आप यंग डायबिटीज डायग्नोज होते हैं, तो अगर आप 75 ईयर्स जीने वाले हैं, तो 40 ईयर्स 35 पे आपको तो 40 साल तक डायबिटीज आपके साथ रहेगी. एंड थ्रू आउट दोस 40 ईयर्स कंट्रोल कितना आपका है वो मैटर करेगा. दैट विल क्यूमुलेटिवली कंट्रीब्यूट टू दी आउटकम्स. इफ यू आर वेल कंट्रोल्ड, वेरी अनलाइकली कि आपको कोई कॉम्प्लिकेशन होगा, बिकॉज डिपेंड करेगा कॉम्प्लिकेशन कितने ड्यूरेशन के लिए शुगर हाई की और कितनी ज्यादा हाई की. तो बहुत ज्यादा हाई शुगर तो शॉर्ट टर्म में आपको कॉम्प्लिकेशन आपको दे सकती है. like आपको weight loss, आप क्योंकि you will feel more urination, excess thirst, and weight loss will happen due to breakdown of muscles which you're losing, which is not a good weight loss. It is unhealthy. Ketone bodies can form, can even lead to an emergency admission to the hospital. So that should not happen. In more medium and long-term complications, diabetes is one disease जो आपके शरीर के किसी भी भाग को affect कर सकता है. Some are more specific, but it is the only disease which can actually affect from top to bottom anywhere it feels like. So you have to really screen for the more common things, which we commonly screen for are नसों पे असर, that is neuropathy. Commonly आप देखते हैं पेशेंट बताते हैं कि मेरे को पैरों में ऐसा लगता है चींटी चलती है, झंझनाहट होती है, टिंगलिंग होती है या एक बर्निंग सेंसेशन होती है, which is called peripheral neuropathy, also called diabetic peripheral neuropathy in a patient जिसको डायबिटीज है. बिकॉज जो हाई शुगर है वो एक केमिकल बेसिकली कंसेप्ट के बेसिस पे जो ऑक्सीडेटिव प्रोडक्ट्स बनाती है नर्व्स पे हार्म करती है. अब याद रखिए इनकी स्टेजिंग होती है डिजीज की, जितना जल्दी आप उसको कैच करके पकड़ के रिपेयर करेंगे उतना आपका प्रोग्नोसिस बेटर है, जितना आप लेट करेंगे उतना आउटकम अच्छा नहीं है. आप देखते हैं लोगों को न्यूरोपैथी होती है, पैरों में सेंसेशन नहीं आती, पैरों में चली जाएगी, एंड फीट आर समथिंग व्हिच इन इंडिया वी वेरी कॉमनली वॉक बेयरफुट. सो यू हैव टू बी वेरी केयरफुल. आपके जूते में अगर शू बाइट हो रहा है या कोई स्टोन भी पड़ा है तो आपको उसकी सेंसेशन नहीं आएगी. आप नंगे पांव मंदिर चले जाएं, मस्जिद चले जाएं, आपको टेम्परेचर का नहीं पता लगेगा. इट कैन लीड टू डैमेज टू द स्किन. देयर हैव बीन सो मेनी केसेस रिपोर्टेड इन विंटर्स where patients were just sitting in front of the heater with their feet and they had diabetic peripheral neuropathy. उनको नहीं पता था, अनजान थे वो, क्योंकि उनको सेंसेशन ही नहीं आ रही थी नसों की वजह से, जो पुअर शुगर कंट्रोल की वजह से, and they had terrible skin burns which led to a lot of problems and hospitalization. So that is one. Other is, as I said, हम जो ज़्यादा cautious होते हैं डायबिटीज स्पेशलिटी, we don't want the kidney to be affected. That is something most dreaded. सब पेशेंट्स डरते हैं, लेकिन मान लीजिए डायबिटीज अगर आप अनकंट्रोल करेंगे तो डायबिटिक किडनी डिजीज, क्रॉनिक किडनी डिजीज या डायबिटिक नेफ्रोपैथी जो कहते हैं हम, वो आपको इनएविटेबल है अगर आप कंट्रोल नहीं करेंगे, एंड दैट इज समथिंग व्हिच इज नॉट डिजायरेबल. आंख के पर्दे पे असर करता है और ये तो बहुत ही इंसिडियस होता है, इसके कोई सिम्टम्स नहीं होते हैं. इसके हर साल आंख का पर्दा, डॉक्टर शालिनी विल बी टेलिंग यू अबाउट इट. Screening is something very important. We Dr. Rajiv and I, we always recommend to every patient once a year कि please अपना retina screen जरूर कराइए. These are very things which we would like to avoid, and they're all preventable if catch in time. And of course, per se अगर diabetes uncontrolled है तो आपको रिस्क पे हमेशा ही रखेगा एक कार्डियोवैस्कुलर और न्यूरोलॉजिकल डिसऑर्डर्स पे. CVD and CAD का रिस्क हमेशा एक रहेगा ही रहेगा डायबिटीज के साथ, अगर अनकंट्रोल्ड डायबिटीज है. प्लीज माइंड यू, अगर वो कंट्रोल्ड डायबिटीज है, जैसे उस पेशेंट ने सवाल पूछा कि मुझे 15 साल हो गए हैं, सवाल ये है कि इस 15 साल में कंट्रोल डायबिटिक थी, कितने टाइम कंट्रोल थी, उस 15 में से 12 साल कंट्रोल थी, 3 साल नहीं थी, तो वो 3 साल का लेगेसी इफेक्ट आपके साथ चलेगा. जब आपकी एजिंग होगी, जब आप और एल्डरली होंगे तो ज्यादा चांसेस हैं नुकसान होने के अगर थोड़ा भी शुगर आउट ऑफ कंट्रोल था. अभी से टाइट रहिए, डिसिप्लिन रहिए, एंड द क्रक्स इज टाइमली फॉलो अप. Patients are always doing well. We have seen in our practice who are following up in time. जब वो टाइम से दिखाते रहेंगे, आपका टाइमली स्क्रीनिंग करते रहेंगे, प्रोटोकॉल्स फॉलो करते रहेंगे, they will be 99.9%. I can assure you will not have any problems.
In fact, with this, again, I just want to take a pause and remind ourselves about one of the very, very important message in here. And I've seen this in my family too. I also come from a family of diabetics and people having a heart disease. So I know this myself. And एक बार मेडिसिन लेके उसी को बार बार नहीं लेते रहे, अपना दोबारा से रीअसेसमेंट करवाएं, रेगुलर स्क्रीनिंग्स करवाएं, एंड डू गो बैक टू योर डॉक्टर्स एंड गेट योर प्रिस्क्रिप्शंस चेक. So I think this is also one of the very important things. With this, Dr. Rajiv, Dr. Paras, I would just like to move to Dr. Shalini. And I think Dr. Shalini, we also had a conversation about this earlier. Eye care in diabetics is also very, very lesser talked about topics.
Very neglected one.
Very neglected ones. In fact, I was surprised to see, and I'm bringing this up intentionally, in fact, that the survey which we floated, hardly anyone asked about how should I take care of what should I know about eye care in diabetes, which is again, which just concerned me, that it is so important, like Dr. Rajiv, Dr. Paras already touched upon it. But people, we just not know that this aspect is also important. So with this, I'm just going to a question. Why is eye care so important, and who needs to be more careful?
So thank you, Swati. Actually, Dr. Paras has already covered. So diabetes basically involves each and every part of the body. The eye is not an exception. So how does diabetes affect the eyes? So basically, eye, especially the back part of the eye, the retina, it has very small vessels which gets affected by diabetes. So diabetes can affect the eye in two ways. In one form, it causes swelling of the central part of the retina, which we call diabetic macular edema, and the other are the neovascular complications. So diabetes can affect in these two ways, which can manifest as vision loss. But the sad part is that the vision loss occurs at a very late stage. It is very disheartening to see that the patients we get, around 40% of patients come to us when already the vision loss has happened. It is, as Dr. Paras also mentioned, it's irreversible. So it is very, very important, especially for the physicians also, like very vigilant physicians like Dr. Paras and Dr. Rajiv. They would send patients, they would encourage patients to go for a diabetic retinopathy checkup. But most of the times it is missed because patients only don't go to the diabetologist, how will they come to us? So it is important that every patient who has diabetes, and the set protocol is that type 1 diabetes, they have to get their first screening done after 5 years of their diagnosis, and type 2 diabetes, they have to get their screening done at the time of diagnosis of diabetes. And then the ophthalmologist or the retina surgeon, they can decide the duration of the follow-ups that have to be taken. But it cannot be emphasized more that care of eye in diabetes is very, very paramount. And as I just mentioned, it is very important that we meet the eye doctor before the damage happens.
I got your point.
हमारे टीचर बोलते थे कि ऑफ्थेल्मोलॉजिस्ट थे मौलाना साहब ने कि आप आई देखोगे फंडस एग्जामिनेशन करोगे you can look into the arteries of the entire body.
Actually.
Because that is the reflection and that is the earliest and the most objective to characterize.
Correct.
Dr. Shalini, one more thing. I think I know that Dr. Paras, Dr. Rajiv, and even you highlighted that sometimes there can be no symptoms and the vision loss happen at a very late stage. But just for our audience and people who have asked this question, how to spot the signs of diabetic retinopathy? Basically, what are the symptoms to watch for, and any quick tips to prevent?
So first I'll take the first half of it. So the most common symptoms the patients will come with is drop in vision. Like first, they might be reading well, but the first symptom that the patients come to us is like the drop in vision, drop in the reading vision, which is usually caused by the macular edema that happens, the retina edema that happens. And usually, what happens is you get a drop in vision, you visit the optician, they change your glasses, and you are happy with it. And sometimes, like in old age, people think my cataract is progressing, but it is not the case. It is not the case. It is because of diabetes you are losing vision. So it is very important to visit your ophthalmologist for that. So drop in vision is one, and the patient can also have this floaters. They will see these black spots in front of their eyes. This is a sign of vitreous hemorrhage, which is a very late complication in diabetes, but we in our practice see a lot of patients coming with vitreous hemorrhage directly. So sometimes even in the worst case scenarios, they might even see a curtain in front of their eyes, which is a sign of a detachment of the retina, which is also a very late sign in the stages of diabetic retinopathy. And about the management, about the treatment part of it, control of diabetes and a regular checkup. These are the two important things that we have to highlight to the patient.
Okay, I understand your point. Maybe just as a closing remark at this point of time, what would you just want to advise to all our, I'm not sure how many people who have joined us online and even in here have got a diabetic retinopathy examination done. So should they get it there and then right after this event, or what do you suggest?
If they have not got it done till now, right after the event, the first thing they should do. And now we in our clinic, in our setup here, we have non-mutatic camera in which we are, and Radical Healthcare has been kind enough to help us with this screening program today. So all of you who are present here should get a retina examination today.
Yeah, of course. Dr. Shani, one more thing. You already introduced the non-mitotic fundus camera, and I know that there's an on-spot report that you can get. I just wanted you to touch a little upon how diabetic retinopathy is diagnosed, like a little about this concept and what does the treatment look like once has been diagnosed.
Right. So sure. So first of all, you have to visit a retina specialist. Even an ophthalmologist would be able to pick up diabetes. So in our clinic, we have two important investigations that we use. One is called optical coherence tomography, or OCT. So when we suspect that the patient has diabetic macular edema, or basically the swelling of the center part of the eye, we diagnose it with the help of the OCT. And then in cases when we have a doubt of new vessels forming, then we may advise an angiography, which is called fundus fluorescein angiography, or FFE. So these are the two basic investigations which support us in along with our clinical diagnosis that we make. The clinical diagnosis is usually made by dilating the pupil of the patient and examining the retina. So this is how we come to the conclusion and the stage of the diabetes. And once the diabetic macroedema or neovascularization complication has been diagnosed, then the treatment is usually in the form of injections, like anti-VEGF injections that we give on a monthly basis or as required, and laser. These are the two important pillars that in which we manage the diabetes. And last but not the least, the good diabetic checkup and good diabetic control cannot be overemphasized here.
Yeah, definitely.
I think here I would like to mention one more thing. It is not only diabetes and hypertension, because many of the time diabetes and hypertension they coexist. दोनों साथ साथ होते हैं और दोनों एक दूसरे को आइस के ऊपर उनका इफेक्ट एडवर्स इफेक्ट होता है. तो what happens is कि people tend to ignore their blood pressure. वो समझते हैं कि blood pressure is a probably they're not educated कि it's an age dependent thing or BP तो ठीक है. So only focusing on one, it has to be a comprehensive management.
And most people with diabetes will also have some or the other comorbidities. So it's very important to be.
And their thing, they act synergistically to spoil the retina. The diabetes and hypertension, they act synergistically to make a bad impact on it.
Dr. Shani, just to highlight, and this screening process, this examination is a non-invasive, painless thing, or
Totally. It's a totally painless thing. Like with the non-mediatic cameras, we don't even need to dilate the eyes. But if we don't have access to the non-mediatic cameras, dilatation is like it's a not less than only 3-hour discomfort that your pupils will be dilated. You won't be able to do the near vision. Otherwise, you are just perfect. You can continue with your normal work the same day of the examination also. So it's a totally painless thing.
so again, with this, we covered eye care, and I would just like to take a pause, go back to our to cover more other aspects. In fact, Dr. Rajiv, I would like to come back to you. Dr. Paras, Dr. Rajiv spoke about macrovascular complications, and we have already spoken about eye care. Dr. Paras already spoke about how important it is to take care of your kidneys, and we had more insights from Dr. Rajiv. Foot care is also one area which is often ignored. Maybe you're washing, doing it on a daily basis, but you just don't notice those changes. I have one question in here, which you should definitely cover, I think. Why do diabetics need a special foot care? How can people with diabetes maintain a basic foot care routine?
Sure, I think a very important point, and Dr. Paras started with some part of pathophysiology of why it happens, and just to extrapolate it from there. Basically, what happens is that people with diabetes, they suffer from peripheral neuropathies, which means that there is a loss of sensation in the body part where the nerve is affected, and that goes to the peripheries first, and then the rest of the bodies also. What that does is that the moment you are you're not sensing any touch or feeling of any cut in your foot, especially, which is more prone because you're walking and you're doing a lot of things with your foot. You tend to not realize that it has cut or there is a injury to your foot, and then you ignore it for a while, and then because of another aspect of diabetes, which is peripheral arterial disease, which basically again is because of the nature of the disease, it leads to a very delayed healing of that particular injury, leading to ulceration, sores, or even gangrene in a very severe case. Nowadays, because of awareness and education, those cases have become a little less. But and I'm sure with Dr. Rajiv and Dr. Paras will agree, during our medical days, especially in small OPDs, minor OPDs, we would see so many cases with non-healing ulcers, which would result into a diabetic foot. And there would be a lot of people who would come from a rural area nearby, and it would be very surprising and shocking that it would be smelling bad because that's the nature of a gangrene, and they would just have neglected it to that extent that they would have not taken care of it because there would be farmers or people working in industrial areas where one day of loss of work would be quite a bit of pay for them. So what they do is they come with when the ulcer has reached a stage where either it needs a debridement where you need to cut that particular area, remove the slough and whatnot. But in very advanced cases, you may even have to amputate the foot or toe or whatever. So having said that, it is very important to take care of the foot. And how you could do it, what you could do is ensure that you examine it regularly, because once you are diagnosed a diabetic, it is important that you know that there is a possibility of a diabetic foot or diabetic ulcer. So it is important that you examine it every day. Two, wash it, clean it, and dry it every day. Now, when you're washing it, it is very important that you ensure that the area between the toes is very closely cleaned and dried. Moisturize it, that will help chapping and cracking. At the same time, Dr. Paris mentioned, but when you're wearing your shoes and your footwear, ensure one have those specialized footwear to always check there is no poking, there is no nail, sometimes that gets stuck, or at least the shoe is clean. And definitely, keep checking with your medical practitioner. That is most important. Also, I think one regular thing that we would otherwise forget, when you're cutting your toenail, be very, very careful, because that's the closest that you can go to inflicting an injury yourself. So be very careful when you're cutting your toenails. Those are a few points that one should. Otherwise, leading to a gangrene, or it leading to a gangrene, is very easy and common in a person suffering from diabetes.
So actually, we are living in a bubble. See, we are living in Gurgaon or maybe Delhi NCR, so it's different. There is access to the best of people, best of facilities, experts. But if you go a little away, then suppose as Dr. Rajiv said, there is an injury. Probably because of lack of education, lack of awareness, their wounds are kept on being dressed, and the ulcer just goes deeper and deeper, it involves the bone, and the sad situation comes. That is number one. The second is the financial part. So it's a very common dictum that the management of diabetes is nothing in comparison to the management of the complications of diabetes. When the complications occur, then the cost of treatment of diabetes just rises exponentially. That's why it is very important to control diabetes as early as possible. Pick up diabetes, educate the patient, diagnose it, treat it early.
And in fact, with this, I also have one sensitive question with me, that is amputation the only way out if I have got a diabetic foot?
See, diabetic foot is a very generic term. Diabetic foot means that a complication which has happened in the foot because of diabetes neuropathy, or ischemia, what is called a neuroischemic. There is a component of neuropathy as well as obstruction of the blood flow. So it's a very generic term, and it has got stages. There may be just a crack, or there may be a non-healing ulcer. So that depends. So it is not, see, amputation is, as Dr. Rajiv said, it is the end stage where you think that the foot cannot be salvaged, or there is such an extensive infection that it has reached the bones and there is no possibility of salvaging it by means of surgery or debridement or anything. So that would be a very, it is a very nihilistic, approach. It is not like that.
Okay. Dr. Rajiv, one more thing, and I think Dr. Paras has already rightly shared that context earlier, where exactly digital healthcare players come into place, where exactly your digital health partner can help you in managing your diabetes well, digital condition management programs. And one of the pain point for patients and people who have written to us is tracking your diabetic condition. So how frequently should I get tested? How frequently should I get my fasting and PP? What is HbA1c? So overall perspective on tracking diabetes.
I think Dr. Paras and Dr. Rajiv already set the base very nicely and clearly. Having said that, digital tools are very helpful. Digital programs are very helpful to manage just one aspect of the entire spectrum of diabetes, which is your psychological behavior as well as habit for sticking to your medication and the routine and monitoring your disease. Now, there was a very nice book recently, Atomic Habits by James Clear. And it mentions 4 pillars of habit, which is, if you want to make something or turn it into a habit, you have to make it easy, accessible, obvious, and rewarding. So if I have to put this framework of 4 into how one can adhere to medication, use digital tools. One is there are a lot of these digital pill boxes that are available. There are even regular pill boxes with days written on top of them. One could use them to remind him or herself to ensure that they are taking the medication duly and regularly. That's number one. Number two is ensuring that when I say, when I mentioned the framework, I said making it accessible. So making even the medicine easily accessible. It should not be, somewhere deep down in some drawer where you are finding it tough to even get to it. So these are small little things, but they help you in not missing a dose. Forget the long term of dropping from a medication, but just missing a dose, because even that may have a very detrimental effect. Like sir was mentioning, hyperglycemia has more long-term issues, but hypoglycemia has immediate emergencies. So we have to be very careful in designing how you help patient form a habit. So making it very easily accessible. Then thirdly, there are also these lot of online reminders that have come. So depending on what medicine, what oral hypoglycemic, if insulin at all, or other medications, whatever you have been prescribed, if reminders can be used to ensure that you are taking them duly, that really helps. And there are a lot of digital tools, without naming, but we can find a lot of them on our app stores or Google stores also.
We have one on our app, our pill reminder.
Yes, yeah, we have it on our. I would no advertisements, but definitely we have a lot of good reminder tools which really help you to stick to your routine. Then also from making the education and awareness, and Dr. Raji was saying, what happens is many a times insulin and few other medications, they're very difficult to abide by because they have a lot of immediate lifestyle changes that one needs to cater to. Now, when suddenly too many things are changing, it is very obvious that the habit will not form. So, talk to your doctor, help him understand what you are facing. Either it's maybe the number of pills that you have to take, maybe insulin dosage that, maybe one or two injections may help rather than having it 3 or 4 times. Again, depending on situation and the person and also the disease stage. But all of these things, and make it rewarding. Let's say, for example, you've taken your medicine, but after 1 or 2 hours, when you're actually supposed to eat, have a healthy snack. That will just make it very rewarding for you to stick to that medication, as well as ensure that you are continuing it for the longest time. Now, people who are aware, who have seen diabetes cases in their family or nearby, and they've seen the complications, they kind of, out of fear psychosis, happen to believe in this and follow it even more duly. But what I just said is even more important for people who are probably not in the society, who are not aware of all of these things, because they tend to take this very lightly. They tend to drop medication and assume, like you said, after 50 years, I'm doing fine, my sugar levels are fine, so might as well just leave it for a while. So those are the ticking points which one should not get to. And all these habit forming digital tools, as well as psychological motivations as per the Atomic Habit books, may really help one to stick to the plan.
Thank you. That is helpful.
Also, I think you mentioned, you have to. Sure.
Okay.
No, thank you so much.
Dr. Rajiv, maybe we can just take a minute. We thought we'll have a memento distribution ceremony towards the end, but maybe we can just, you can have yours while we leave.
No, we have to.
And thank you so much for joining us today.
It's a very good initiative.
Thank you so much. Thank you for coming and joining us.
I'm sorry, it will be very odd for me to leave.
Thank you.
But in fact, I thought of leaving early, but I was so engrossed in everything and just didn't feel like. But there are patients who are just, I try to reschedule, but.
So this is a goodie bag, a very small thing from our side, but.
Thank you so much.
Thank you. I'm looking forward to having further interactions of this sort.
Thank you so much.
Thanks a lot.
Thank you, sir. Thank you. Okay, to to continue, I think there was second part to your question, which was
Yes, the tracking of diabetes.
tracking of diabetes. That is also super important. Now, tracking of diabetes is not just tracking your tests or your medication, but it is about your habits, diet. Also, at the same time, your like Dr. Paras was saying, seeing your doctor regularly. So all of these needs to be tracked very religiously. When it comes to tests, one need to definitely do the HbA1c very regularly over 3 months, 6 months, so that there is a very nice track of the average of 3 months, which is what it tells, and it is a very important indicator and one of the mainstays for all the diabetologists now to ensure that diabetes is actually going down, because once or twice a day, like even Dr. Rajiv mentioned, after a binge night or a party night, it happens that the sugar may spike or it may just go down. So it is important to have that. Plus also, of course, your 3 glucose levels, which are fasting, postprandial, which is after your food, or random. Right now, all of these 3 have a very technical mainstay in terms of what one signifies, and please. Telling it in detail right now would not be very easy, but just to mention it that yes, your morning fasting sample is the easiest and the best, just to for the lack of understanding. But that is your number one mainstay if you really want to manage it. Also, there are glucose tolerance tests where you're first measured, your glucose is measured before the glucose, and then you're given some part of glucose, and then at 1, 2, and 3 hours you are again tested for glucose levels. So again, they all have medical implications and insight, which help a doctor to come to a conclusion whether insulin is less or resistance is more, or like how Dr. Paras was mentioning about the pathophysiology or physiology of how the pancreas and the cells they work. So it's very important. Secondly, for the diet, again, we have a lot of fantastic apps nowadays where you can actually track your diet, ensure that you count your calories, ensure that you can even with the continuous glucose monitoring device, you could even do certain cases. I'm not saying everybody needs to get that. A glucometer is good enough, but a CGM tool may really help in cases of people who need very, very rigorous measuring of their diabetes in the start of the disease, or maybe in the later half when it's got a little complicated. At the same time, it may also help you as a person, if you have it, to form that habit better, because you keep seeing the glucose levels and you have a little bit of a scare, and then you modify your habit. So diet, number one. Number two, the test. Number three, in terms of your lifestyle or exercise. So you have a lot of, and this is where digitization is helping. You have tools where you can, lot of the apps where you can schedule your exercises. You can even go to gym, but if you join gym and not going to the gym, then it's as good as no gym. But at least you can have your homely exercises, which I think we got quite a bit used to during COVID. So at least your yogas at home mat, it is an easy one. Also at the same time, lastly, ensure that you are seeing your doctor very, very regularly. That's very important. I mean, when I say regularly, it doesn't have to be weekly, but at least half yearly, 1 yearly, or whatever the doctor is telling you. That is important. If you see any spike or a downward trend or whatever, if there is any sudden change in your parameters, you have to go and see a doctor. That's it.
Touched upon quite a few pertinent things, and just to sum it all, we spoke about how important is tracking in diabetes, and alongside your fasting and post-meal values, HbA1c or glycosylated hemoglobin levels, which is an average of last 3 months sugar values, is also important because it's give you a complete blood picture of how your blood sugar levels have been doing. Alongside your sugar levels, you need to get yourself screened for diabetes retinopathy, and to consult your doctors about your risk of being at different diabetic complications, including diabetic kidney disease, diabetic neuropathy, diabetic nephropathy, I mean kidney only. And exactly, that's where that's super important. While we spoke about how important is monitoring, I think one of the very, very crucial topic and also most talked about is monitoring weight, and which brings me to weight management. And Dr. Mikla, I would just like to bring up some questions what we have received. Uh, is weight and diabetes related? And this one is my personal favorite. One of the user has asked that my doctor told me that with diabetes I will lose weight, but most people with diabetes are obese. So, okay, so how, yeah, over to you.
I think that's a really good question. But usse pehle, to answer your question, let me create a little bit awareness of what obesity is and why there's a field called obesity medicine in US and it's a proper degree. So if you guys zoom out your lens a little bit, diabetes is just a part of a jigsaw puzzle. Okay, the bigger picture here is obesity looking at it. It is not just BMI, it is not a number. Obesity is a disease, and if so rightly said, it is the rising epidemic in the world right now, especially including childhood obesity, जिसके बारे में बहुत ही अलग से discussion होता है कि why there is childhood obesity. It's mainly because हमारा खुद का जो lifestyle change हो गया है. There is what parents are eating, obviously the child will eat, and so there's different reasons. But first creating awareness कि it's not just BMI. अगर आपका BMI 25 and above है, आप overweight हो, and that's not what it is. Especially in Asian Indians, जो हमारी population है, उसमें there are more better predictors of obesity. So somebody had mentioned जैसे कि हमारा जो baseline है, जो abdominal obesity है, men में it's more of a strong predictor. Women में जैसे waist to hip ratio है, so we'll see कि women में the fat is more around your glutes, right? Like so your buttocks. So that is a stronger predictor. Now आप उसको देखते कैसे हो? There is the way we are, as trained physicians, we see it as internal and external, right? तो आपकी जो अंदर का होता है उसको हम sick cell adipose disease कहते हैं. In simple language, it is कि जो unhealthy cholesterol है, unhealthy weight है, वो body में कर क्या रहा है? You see a lot of people here are diagnosed with fatty liver disease, for example. तो वो जो है उसको हम it's a good example of visceral obesity. मतलब कि जो आपकी organs में deposition हो रही है unhealthy cholesterol. आप देखोगे कि heart की vessels में deposition हो रही है, इसलिए cardiac disease, heart attacks ये सब बढ़ रहे हैं. Same thing with your brain vessels. So the risk of brain stroke is increasing because these are depositing over there. Another very good example is PCOS, which is underdiagnosed in women in general. And it's a major cause कि obesity उसका एक reason है for PCOS. Coming to external, overweight या unhealthy weight, जिसको I like to address it as unhealthy weight rather than giving it a definition. जैसे आप बहुत patients देखोगे कि उनको knees में pressure है, so they are like more prone to osteoarthritis. They can't exercise क्योंकि घुटनों में दर्द हो रहा है, back में दर्द हो रहा है, किसी की नस दब गई है, sciatic nerve is like very common problem, right? So ये सारी mechanical problem because of that pressure that's building on your body, you're carrying this unhealthy weight around you, right? So all this adds up and creates problems like diabetes, uncontrolled hypertension, unhealthy cholesterol, जिसे हम dyslipidemia के नाम से जानते हैं, fatty liver disease, your risk for heart attacks increase, your risk for brain strokes increase. So you ask me, are they related? They are very much related. Having said that, not all diabetics are overweight or obese, but the number is almost 80 to 90% of people who are obese have very high likelihood of developing diabetes. So this is like a very important term to relate. कि उल्टा नहीं है, but the risk increases when you're overweight and obese. In fact, according to the recent most data at NHS, if you're a normal BMI versus आपका unhealthy BMI है, उसकी risk almost 80% है कि आपको 80 times likely of developing diabetes होगी. So this is a very strong number. Now we all talked about, Dr. Paras had mentioned, Dr. Rajiv had mentioned, lifestyle modification and different monitoring. And so to give you an example, अभी हमारे पास इतनी apps हैं, we have so many food options, we have like so much awareness. So why is the trend rising? Because it's a behavioral problem. As they said, as somebody mentioned, Dr. Rajiv had mentioned, diabetes is a behavioral disease. So is obesity. So please consider that as a disease. It's not just a term, right? So इसमें problem अब क्या आती है with obesity and diabetes management? It's कि these are lifelong diseases हम assume कर लेते हैं कि हमें पूरी उम्र भर दवाई लेनी है. And recently in my practice here, I've seen कि a lot of people are coming with like, younger age, 20 to 30 के age group में आ रहे हैं, and they have HbA1c of like 13.5, and they're overwhelmed कि मुझे अचानक से diabetes कहाँ से हो गई. I'm like, not that, इतना मोटा नहीं हूँ, मेरी lifestyle भी अच्छी है. So, but उसमें जैसे Dr. Rajiv had mentioned कि stress is also very important, right? So all these fields of little, like lifestyle modification, stress modification, आप जानोगे नहीं कि बहुत लोगों को underlying anxiety है. A lot of people are depressed, subclinical depression, या they won't tell you कि they're depressed because of, Indian, या हमारी environmental background की वजह से, या family की problems की वजह से, there's financial stress, there's just environmental stress, pollution की वजह से, हमारी body is in a chronic inflammation state. आप किसी का भी CRP करवा लो, which is an indicator of inflammation in your body, it's generally high. So the difference I'm trying to come ki I practiced in US for years, and the reason I moved to India is because थोड़ा वो जो आप storm देख चुके हो US में, the rising obesity, the rising unhealthy lifestyle, childhood obesity, you can see that trend coming in India. And as a physician, I feel like let's just not make it happen कि हम उस bad state से पहुंच जाएं जो हमने US में देखा है. And you can see the westernization, you mentioned that word, right? So coming to that, what does it really mean? You can see in the last decade हमारा जो food है in Asia has become more processed. We were used to eating like more fresh and healthy vegetables, but अब आप देखोगे frozen items अचानक से बढ़ गए हैं. आप बहुत सारे departmental store में देखोगे, there's a huge frozen section. There's all these preservatives like hummus. Hummus, but आपको जो बीच का जो stock होता है ना, जो shelf होता है, we tell our patients to avoid that. We tell them कि आप side से खरीदो सामान, because that's where आपके plug sockets हैं, वहाँ पे fresh item है, वहाँ पे आपको fresh vegetables दिखती हैं. पर जो बीच का जो होता है ना section in number 1, it's filled with preservatives or high preservative food. That's what our kids are also eating. They're eating like processed food, eating frozen food because of lack of time, lack of like preparation of meals. So all of this comes together. And so to answer your question, can weight gain and diabetes are they interrelated? They're definitely interrelated. As I mentioned very clearly medically, not all causes of diabetes are overweight, but if you are having unhealthy weight, you're at a risk of developing diabetes. In fact, they also had a study कि अगर आप 5% भी अपना weight reduce कर लेते हो, then it can decrease your risk of developing diabetes by 50%. Again, a huge number अगर आप सोचोगे हमारी population wise. And I would just want to add कि जो हम behavior modification बोलते हैं, despite all these things around us, it's all about motivation. There's a lot of things that act in it. There's like mindfulness, and I'm sure like Ms. Abhika will talk about it. But there needs to be a little more awareness ki what exactly and how these hormones, these sick cell problems are playing a role in these kind of diseases. We as physicians are aware, but general population में इतनी awareness नहीं है कि क्यों आपको weight loss करना जरूरी है. Another reason, I'm sorry, I'm taking a little longer. Another reason I became or chose obesity medicine as my super specialty is because, and I'm very proud of it, is because I love taking off medicines from people when medically appropriate. I don't like adding it. So when I see my patients lose weight and then I can take off certain medicines, titrate them down, it makes me very, very proud. And that is what exactly this field is doing. The awareness and the education should be going. It's a holistic approach. We as physicians, जैसे आपने देखा कि यहाँ पे इतना बड़ा panel है. And we're all treating one disease right now. We're talking about one disease, right? This is how much it takes to bring people together to treat one proper disease, right? So, can you imagine कि कितनी expertise चाहिए? कोई एक retina specialist है, एक diabetologist है, some, like digital health. Everyone is playing a role. Behavior modification. So all of this plays a role. So through you, at least I want to create awareness कि do not take, especially in Indian population, do not take your weight lightly. It definitely increases your risk for a lot of other diseases.
No, I think super important. I was just taking a while to look at the questions that Monali and Ashin has forwarded to me, and we have a couple of clinical questions coming. I'll just place them towards the end of the session. Just one more thing. I think you already touched upon it, but maybe to bring in other things that you already mentioned about those. how does managing weight helps in managing diabetes? So does managing weight helps in managing diabetes? Any quick take?
It absolutely does. I'll go a little more medical detail into it. When you lose weight, even by 5%, as मैंने mentioned, yeah, your body's insulin sensitivity increases. Dr. Paras had mentioned the pathophysiology की insulin resistance क्या होती है body में. तो आप जब थोड़ा सा भी weight loss करते हो, आपकी mobilization of the lipid, जो deposited है, जो जमा हुआ है वहाँ पे होती है. There's a lot of other hormones that play a role. It's not just about insulin. There's leptin, there's ghrelin. There is, like neurohormones like dopamine and serotonin. ये सारा मिलके there's a, huge role for every hormone that is playing. But more likely, the answer here is अगर आप थोड़ा सा भी weight loss करते हो, तो आपकी insulin sensitivity बढ़ती है body में. तो आपका जो the insulin floating around which was unable to attach to the receptors, it is more sensitive to that now, and so by default it will improve your diabetes.
It's very important to know and take note of that managing weight helps by increasing the uptake of glucose. Okay, with this I just want to move to two very, very crucial, and we spoke a lot about how important behavioral modification and lifestyle factors are in managing diabetes. And diet and physical activity are two very, very important pillars alongside stress, sleep and other crucial factors. With this, Chavi, I'll move on to you. And I just to set a context, quite a lot of people asked us about diet, and I've just sort of summed it up here because we received a lot of queries around diets, so we sort of got the crux here. And I'll just begin with my first question. Okay, diet is crucial, but what can I do on a daily basis? What are the some important do's that every diabetic must take care of?
See, first of all, the biggest problem or the biggest source of anxiety which arises is from the fact that I have diabetes, so I have to do something special. So suddenly, before thinking or before starting any journey in a positive note, the person feels left out. And that happens daily, every time that person has to have food. So that thought sticks here. So they feel that we cannot eat something which we like. I am the only person who has to eat healthy. I am the only person who has to do specific things. So a person living with diabetes doesn't have to do anything special because we are somewhere in the same boat. We can be, we can be placed at different levels in that boat or different places, but we are in the same boat. Somewhere down the line, we have same genes, we have same circumstances. Our bodies are going through that change. So before thinking about the problem, first we should think about: am I nourishing myself? क्या मैं अपने आप को, अपनी बॉडी को नरिश कर पा रहा हूँ या कर पा रही हूँ? So the first do's comes is start nourishing your body. Rather than first thinking about what you have to reduce, think about what you have to increase to nourish yourself. Am I eating good amount of vegetables? Am I eating fresh vegetables? Am I taking enough proteins from different sources? Am I relying only on processed grains, or I am taking better grains? Or what am I eating? What my plate is giving me? Am I getting good nutrients out of my plate? So when we start thinking about all these things, so what happens? We eventually start adding good things in our meals, and automatically जो चीजें हमें कम करनी है वो कम होने लगती है. Because the problem is, many people they face that hunger at 5 or 6 o'clock is tremendous. ये हम सब feel करते हैं. But very few of them, they are not able to recognize that from where it starts. Maybe it starts from the morning. So हम उसे counteract करने के लिए हम अगर evening से काम करना start करेंगे तो हम कहीं land up नहीं करेंगे. But अगर हम morning से ही देखेंगे कि क्या मैंने सही खाया, या start sparing 10 minutes for your meals, peaceful 10 minutes. Get out of your screen and sit quietly just for 10 minutes. Take out those 10 minutes. हम 10 minutes dress up होने के लिए लेते हैं. We always pick our phone and see something in the morning. But we say कि खाना खाने का time नहीं था या खाना बनाने का time नहीं था. So if we prioritize that, so we will see कि बहुत सारी चीजें sort out होने लगेंगी. तो first thing, do's में give priority to what you are eating. Think about nourishing yourself first. When you will think about nourishing yourself, you will automatically pick up few vegetables, few fruits, nuts. Then whenever you choose any grains, rather than always picking about processed food, try to pick fresh. And don't focus on that I have to eat something different. Think about how you can improvise what is prepared at home. Because it is about everybody. It is not about one person alone.
In fact, I remember having this conversation at the onset of our diabetes management program. I went to Chavi and I just want to share this anecdote. It's an anecdote only now that we were just thinking what should an ideal diabetic diet look like? And that's where Chavi just corrected me. No, Swati, so it's not a diabetic diet. Maybe we shouldn't position it like this. It's just a balanced diet. Because the moment you get to know that it's a diabetic diet or something extra that you need to give, the stress starts building up. So that I really like that point, and I just whosoever wants to talk about diet and diabetes or what should I do, people just randomly ask questions, knowing that you're a doctor and you're not a specialist in diabetes. Still, that happens. So my only thing which I would say is it's not a diabetic diet; it's just a balanced diet, and I have learned this from you. So
I will also take this back home.
Sure, sure.
Because it is taking a lot of pressure from the whole mind. When you say that you don't have
It
to
is very important because nowadays when you meet people, now what you think, you closely observe them. So you will find two things. One, either they are at the extreme one end,
stop
not
everything.
taking care of themselves. Second, they want to reach to extreme other end, wherein they want everything to get reversed. Everything they want just from second day onwards, things should wash out. So that will never happen. It's a journey, and it's not a journey of 1 month, 2 months, 3 months, or 6 months. Even all the studies which are there, no matter about diabetes reversal or whatever, they are not long-standing studies. Why? Because it is very difficult to shift anything completely. 360 degree में आप turn नहीं कर सकते, not possible. So rather than that, let's improvise. Small bits so that we can inculcate all these changes as our habits. When we will inculcate good habits, then things will stay with us for a longer period of time. And slowly change do happen.
yeah. Now that we have spoken about those, I think it's very, very important to also touch upon what shouldn't we do. Most important don'ts about diet in diabetes.
So first of all, before talking about diet, first thing is try to relax your mind. Don't get very anxious if you one day know that okay, I have this problem. Think about closely what was the reason, what I was not doing properly, because of which I landed here. Because maybe it is not only diet, it can be stress also. Maybe people tried from their end to eat healthy or to carry healthy stuff, but they end up adding something. So first think about factors. Second, try to understand who am I as a being. मैं क्या कर सकती हूँ या मैं क्या कर सकता हूँ at this point of time, because शायद मेरे लिए possible नहीं है कि मैं हर चीज बदल दूँ. Third thing, if you want to stop something, first just eliminate packaged and processed food from day to day routine. Like people skip their breakfast and they don't mind picking up biscuits and with tea or coffee, and that is their breakfast many a times. Or they just think that कि breakfast तो skip कर दिया और बीच में जाके कुछ भी munch कर लेंगे. So it is very important to eliminate packaged and processed food from our diet, rather than always relying on things which are easily available or easy to do. Focus on planning your meals a day before so that you can procure those stuff जो आपको बनाने के लिए चाहिए, या फिर आप कुछ half done करके रख सकते हो because morning में अगर आपके पास ज़्यादा time नहीं है. Third, there is no problem to eat out, या फिर आप अगर मीठा खा रहे हो तो that is not a bigger problem, because it will not happen in our life कि कभी कोई festivities नहीं आएगी या कभी हम socialize नहीं करेंगे या कभी मुझे कुछ different खाने का मन नहीं करेगा. This is not the way. All these things are part of our life, and somewhere down the line it is important also. बट व्हाट इज इम्पोर्टेंट इज कि उनको फिक्स करना जरूरी है. अगर आपका एट रैंडम ऑर्डरिंग ऑफ फूड, एट रैंडम हैविंग मील्स आउटसाइड जस्ट बिकॉज आई डोंट हैव मील्स, at random picking of packaged and processed food and not thinking when I'm eating. So other problem which we usually face that people have night shifts or they work like slightly late at night. So people have this perception because I'm awake till 12 I should eat. Because I'm awake till 2 I should eat. So till the time my eyes are open, my mouth should so it is very important to close this thing at certain time. If we don't close, that will create trouble for us. So just first eliminate things which are not nourishing you. जो आपको कुछ नहीं दे रहे, सिर्फ आपके फूड में वो एक स्पेस है बिकॉज आपको लग रहा है कि टाइम नहीं है या हमने प्री प्लान नहीं किया. और जो चीजें आपकी वो नरिश कर रही हैं एक्चुअली जो फ्रेश है उनको आप स्पेस दो. सो व्हेन वी स्टार्ट डूइंग दैट देन आवर बॉडी आल्सो इंडिकेट्स. जब आप हेल्दी खाओगे उसके बाद अगर आप 1 वीक या 10 डेज बाद कुछ अनहेल्दी पिक करोगे, आपको आपकी बॉडी साइन देगी यू हैड समथिंग रॉन्ग. एंड दो साइंस कीप ऑन कमिंग. देन यू फील कि नहीं ये खा के मुझे अच्छा नहीं लगता है, ऑटोमेटिकली उसकी फ्रीक्वेंसी कम होने लगती है. सो बॉडी गिव्स साइंस फॉर ईच एंड एवरीथिंग. जो वी डोंट ईट और लिसन टू देम कॉन्शियसली, अगर आप देखोगे तो आपको साइंस मिलने लगते हैं. एंड व्हेन वी ट्रैक दोज साइंस we start changing our habits slowly.
Very rightly said. And so we covered do's, we covered don'ts, and I just like to take few minutes, and I think we should spend. It's worth taking time out here. Chadi, there's a question, but I'm also extending and adding on to it. People have mentioned that they take sugar-free biscuits or they take fiber-rich cookies. So what is your take on that? And we also have a few questions in here that I take biscuits, I take Mari with my chai. Is that okay? And so I know we already have, I see the smiles on your faces, but I just want to have an expert take as well.
See, one thing is, those who are manufacturing those products, they also know where do we stand. Okay? So ऐसा नहीं है कि वो population study नहीं करते हैं. उन्हें पता है कि there is an epidemic of obesity, there is an epidemic of diabetes. They know that that product is unhealthy. So that is why these options come into the scene. So what's written at the front of the packet is actually what company wants us to see and get attracted. What is specifically for us to study is written at the back of the packet in very minute letters, which many a times you are not able to read without your glasses. So before picking up anything, understand ki what is this, why it is being manufactured and why. So these fonts are used because to make them attract your eyes. So definitely there is something fishy. Turn the packet around. See first 6 ingredients. अगर आपका बिस्किट कहते हैं it is high fiber biscuit, search for the fiber then. High fiber में fiber first होना चाहिए. So where you will find fiber at the last या फिर third last में होगा. You will see oat और रागी बिस्किट first 6 ingredients होंगे मैदा, palm oil. Then you will get lot of sugar, other kinds of sugar like which can come with different names like fructose, corn syrup. Then glucose, honey, liquid glucose, maltose, all these things, fruit sugars will come. And then last में कहीं आपको मिलेगा 5% ragi or oats or anything. So when you will start reading labels, nutrition labels, और जब आप ingredients read करना start करोगे तब आपको समझ में आएगा what is there. Secondly, किसी भी चीज में अगर कोई cooking जानता है, एक simple सी बात है, हम घर पे इंडियन स्वीट्स बनाते हैं, हम मैदा लेते हैं, मठरी बना रहे हैं. सो क्रंच क्रिएट करने के लिए क्या करा जाता है? मोइन ऐड किया जाता है. व्हाट इज मोइन? दैट इज सम ऑयल और फैट मैदे में ऐड किया जाता है. अब उसमें अगर आप शुगर ऐड करो या ना करो, दैट हैज ग्रेन, दैट हैज फैट एंड इट विल कन्वर्ट इनटू ग्लूकोज. डाइजेस्ट होने के बाद उसको ग्लूकोज में कन्वर्ट होना ही है. आप यही चीज आटे के साथ घर पे करके देखो. So called high fiber flour. So आटे को बाइंडिंग देने के लिए क्या उतना ही मोइन चाहिए. So जब आप कुकिंग करोगे तो आपको समझ में आएगा, you have to add more fat to it. So there are only two ingredients which can enhance the taste of any product. One is sugar and the other, or sugar and the fat. And the salt also, these things also acts as a preservative. So any product which will not have sugar will definitely have more fat, and the product which will have less fat will have more sugar somewhere down the line, or other additives also. So that's why these things does not behave in a similar manner. Plus they are chemically generated. The taste is chemically generated, so that's why they tend to behave very differently. हम जो सोचते हैं कि दो बिस्किट कैसे behave करेंगे, actually वो वैसे behave नहीं करते. Means we have seen in kids in CGMS, Maggie can give a spike for 12 hours in kids with type 1 diabetes. Namkeen and biscuits can give spike for even 6 hours also. But these are, problem is that we have seen it, so we perceive it differently. But in layman, log nahi samajh paate those spikes. So that's where technology also plays a very vital role. When you see these, when people see these similar spikes, when they put CGMS device and they notice that okay, ये मैंने तो 2 ही बिस्किट खाए थे, ये हो गया है, then they understand those things.
In fact, with this, because you've already touched upon that this shouldn't be done, and you also spoke about unhealthy snacking. What are quick options for healthy snacking? शाम में चाय के साथ बिस्किट की जगह क्या खा सकते हैं?
फर्स्ट ऑफ ऑल, आपको चाय पीनी है तो कोई मैंडेटरी रूल नहीं है कि स्नैक खाना ही. स्नैक तब खाइए जब भूख लगे. It's like having, I want to have tea and I want to have snack are ideally two different things. I can have tea because I want some, just wanted to have tea, but have snacks if you are hungry. ठीक है, and that too first drink water. Probably अगर बहुत देर से पानी नहीं पिया है तो we are more thirsty at that time. And then wait, and then if you feel hungry, try to pick up those things जो आप खाने में नहीं खा पाए थे. You pick up fruits, you pick up nuts. You can keep some nuts on your with you. आप nuts and roasted मखाना, but not packaged roasted मखाना. अगर आपने freshly घर में बनाया है, that too combination of these things आप अपने पास रख सकते हो. You can carry some healthy snacks with you. Even you can have कुछ sprouts ले लिए उस टाइम पे, कुछ tangy खाना है तो फ्रूट चाट बना ली, या फिर सॉटे पनीर ले लिया, या फिर आपने कुछ भेल बना ली विद नट्स एंड डिफरेंट थिंग्स. सो आपको क्या मतलब you just have to plan your snacks and carry those stuff with you. अगर आप कुछ कैरी करके नहीं लेके गए हो तो जरूरी नहीं है कि आपको हेल्दी ही मिलेगा. एंड थिंक अबाउट कि मुझे आज कुछ टैंगी खाने का मन है तो वैसा ही बना के लेके जाओ. अगर टैंगी स्नैक खाना है और हम फ्रूट सामने रखेंगे तो शायद हम नहीं पिक करेंगे. Or do some change in that so that it will satisfy your taste buds, because the problem is that when we don't think about our taste buds and we relate it कि ये तो सिर्फ तभी satisfy हो सकता है जब हम unhealthy खाएंगे. But we can think about.
So maybe just as a quick reminder, nuts, fruits, sprouted grains should be our go-to options.
Healthy bhels आप बना सकते हो with different combinations of sprouts and combination of peanuts and sprouts and makhana and chana and peanuts का combination. All these things, these are variable different combinations जो हम अपने पास prepare करके रख सकते हैं.
Okay, we have taken a note of it and hope our audiences have also taken a note of it. I'll just go back to Artika and maybe we'll just overshoot the time by 10-15 more minutes because I have a list of questions which I will take up after one more important aspect. So Artika, now that we have covered diet, which is one of the most common pain points I would say for many people having diabetes, other pain area which is not just a pain point for diabetics but also people who generally want to stay healthy or maybe look slimmer. I'm just putting it this way because this is the concern that people put, right? So it's physical activity. So with this, I have one question, and then again, I'll just hand over the forum to you. How people with diabetes can benefit from keeping physically active? Is exercise very important, or can I just do simple yoga at home?
So first of all, simple yoga, if done properly, can be very impactful. Number one. Number two, any form of exercise, makes you feel very happy. And we've all been talking about stress here. Yeah. So at the onset, I want to, tell our viewers the definition of the word stress. Simply put, it is too much work, too little time, and no energy to do it. Yeah. And so I get a lot of young professionals coming to me, and I deal with a lot of youngsters. I see them coming to me and saying, they've become pre-diabetic, they do not have energy, the sleep is not good, they don't sleep till 2 a.m., they are on Netflix, then 6 a.m., 7 a.m., they have to get up. So there is so much of stress in the system. Most of them are suffering from something called the adrenal fatigue, जिसका उनको कुछ पता भी नहीं है. Okay, so it all starts from there, and like if I were to just tell the viewers one thing, that most of us, and especially when I talk about these youngsters, young professionals, and all of us here sitting here, the kind of lifestyle that we have, we are always in the fight or flight mode. Okay? Now in the pre-Homo sapien days, we hota tha fight and flight mode. But दिन भर में 5 या 6 बार होता. We would get into that flight and fight mode only when we would see a danger, or we had to fight a danger 5 to 6 times in a day. Now, current position, we see this fight to flight mode happening to us not 5 to 6 times in a day, 5 to 6 times every hour. Are you getting this? So this kind of adrenal fatigue which we are going through, this fight and flight mode that we are going through, has to be changed. And that is where I say we have to make people stress-free from the fight and flight mode to the rest and digest mode. And there exercise, physical exercise and mindfulness, meditation plays a very, very important role. Yeah. So the moment you start exercising, so let me take exercise. You want me to continue with this?
Yes. Yeah, sure. Just that this one very specific question that can I do yoga at home and still manage my diabetes?
Absolutely. So yoga can really, really help you get stress free if done properly under proper guidance. Just don't watch yoga from YouTube. And yoga means union, body, mind, breath, everything has to come together, and it will definitely help you with your diabetes, for sure.
In fact, I think Atika, I understand you just stopped yourself because you thought maybe, but I think we can take some more time if it is okay with all the other panelists and maybe cover a little about mindfulness, because I personally feel mindfulness is one zone. Mindful eating, mindful thinking, it's something which has been covered in blogs, but coming from an expert like you, I think it would mean a lot.
So it's very important. People like you and me who are living in cities, it is not possible for us to just close our eyes and go into meditation. It's just not possible. Nahi hoga, okay? I'll tell you the definition of meditation, but before you meditate, you must do some physical exercise. You must do some pranayama, some breath work. Then the rest in meditation is going to be deeper. Yeah. So since we are addressing diabetes, I just want to give a few tips.
Sure.
Is that okay? So then after this comes yoga, then comes some strength building, stamina building. That means swimming, cycling, some form of these exercise. You put in your schedule at least once or twice a week, thrice a week. Yeah. Stamina building, strength building. Do some weights. Weights is very important for every person who is suffering from diabetes. That's where most of your muscles will absorb the glucose. We all know that sitting here on this panel. So this is exercise, the physical exercise. And then if you sit on your yoga mat or on your couch, close your eyes and meditate, your meditation will be much deeper. Now what is meditation? Meditation is the art of doing nothing. Because सवेरे उठते ही हम कुछ ना कुछ करना शुरू कर देते हैं. We get into this habit of control. We want a life. We get into our WhatsApp, the mind starts working. So meditation is something you need to do where you just do nothing. So three important qualifications when you sit with your eyes closed. I want nothing for the next 10 minutes. I do nothing for the next 10 minutes. And I am nothing for the next 10 minutes. And sleep. That's it. And I'm just going to sit and just be. I'm just going to watch my thoughts like a movie. If my thoughts, sometimes you start talking to our thoughts, then that's not meditation. एक वार्तालाप शुरू हो गया, you're having a conversation with your thought. That's not meditation. So the moment that happens, you start, talking with your thoughts. पठान जाना है, कौन सी jeans पहनेंगे, ये करेंगे, वो करेंगे. Then there's no meditation. Then what you do? One tip I want to give to all the viewers: if that happens to you, just become aware of your breath. सांस अंदर जा रही है, बाहर आ रही है. Just be aware of that breath, and that will take you to a rest. It will activate the rest and digest hormone. It will activate your vagus nerve, which you need to do when you want to get down your glucose levels and rest and digest.
I think you have put it really nicely, and I'm also just taking it with me this day that I am nothing for the next 10 minutes. Maybe the sequence can be a little here and there. I want nothing for the next 10 minutes. I do nothing for the next 10 minutes, and I am nothing for the next 10 minutes. And it's I think it's an amazing way to just think it like this and practice it like that. With this, I understand it may be a little difficult to demonstrate what we can do, but there's one thing. If it is possible, maybe we can just speak a little about it. What are some most basic yoga forms that are easily doable for elderly? Because we have spoken a lot about youngsters, but people with elderly people, how can they involve in simple yoga forms?
So, Surya Namaskar is one thing which really helps. So, अगर आप अपने yoga mat पे बहुत ही हल्के तरीके से सूर्य नमस्कार कर सकते हो, because you're in one Surya Namaskar you're bending forward and coming back 5 to 6 times. The pancreas are taken care of. Yeah. So suppose you're really elderly, you're a senior citizen, आप chair पे बैठ के सूर्य नमस्कार कर सकते हो. Okay, that is also possible. So Surya Namaskar really helps. Then all these asanas, if you want me to name them, Manduk Asana, Paschimottan Asana, Ardha Matsendra Asana, where you're squeezing the pancreas, you're twisting the spine. This all really, really helps. We can go on with this, but if I could have demonstrated, it would have been different. But Paschimottanasana, Mandukasana, Ardha Matsyendrasana, Vakrasana, these all really. Wherever there is a spine twist and wherever there is like a little bit of a blood squeezing in and out in this region, your pancreatic zone.
Okay, and like you mentioned it, I just want to highlight it again that there are over 1 crore people who are connected with us via our newsletter channel. So we had already thought that after this event, we'll also post like a text-based newsletter around all of the important takeaways shared in this event, and we'll also make a toolkit out of it. So we can cover all these names that you have mentioned for elderly specifically that they can do. I love Surya Namaskar, but little did I know that elderly can do it on chair. So we can share these learnings and all the takeaways. Like Chavi also covered fat diets and what to read on your labels later and share it across.
And yoga under the guidance of a trainer.
That you don't enjoy yourself.
Yes.
I think that's where basic yoga forms are important. Okay, now quickly, and thank you so much. I think we had a great round of discussion, lots of important insights, and also we covered quite a pertinent, crucial questions from our patient base. With this, I just want to open the forum for a short question and answer round. I have received questions that have come through online channels. I still can feel the vibration in my pocket. There are a lot of questions, but let's just cover these and have more questions from our audience. And then
let's just put them in a crux. And there's a specific question by Mr. Mrityunjay, if you want to take that and
rest for life. I think it's usually covered during the conversation.
Yeah, but I see there is one more thing which is very, very important. I've read it and I'll just cover it in the sequence. But before that, sir and our audience, do you have any questions? Because now the forum is open for an interactive session. So if you just want to have any questions with any of our experts around any of the particular theme or about your medicines, now it's the time.
Just a small question. We are diabetic. I am diabetic and almost for 18 years. And it's controlled diabetes. Like B1C is less than 7. I am maintaining, I am exercising and doing everything. Now we are hearing a lot of things about diabetic reversal. And I just want to understand the difference because they offer packages, they say we'll guarantee you this, that, and how that is helpful or not. I just want to understand that.
So it's something very important. When we talk about diabetes as a disease, as we told before, that it's a disease typically that's going to stay. It's an interplay of your genetic predisposition and आपका lifestyle. So obviously आपके treatment component में lifestyle component का बहुत I would say 40-50% रोल है, कुछ उसकी medicines का है. तो पर से जो करंट एविडेंस है जो मैं मानता हूँ या बहुत मेरे कलीग मानते हैं कि हम डायबिटीज को पर से डोंट फील कि हम उसे रिवर्स कर सकते हैं, उसको हम रेमिट कर सकते हैं. रेमिटेंस मींस यू कैन बी ऑफ मेडिसिन बेस्ड ऑन योर इम्प्रूव्ड एंड इंसेप्टेड लाइफस्टाइल. हमारा मतलब पर्पस ये है कि हम दवाइयाँ हटा रहे हैं सिस्टम, राइट? लेकिन आप लाइफस्टाइल तो नहीं चेंज कर, लाइफस्टाइल डायबिटीज जीरो ऑफिस आ जाएगी. सो रेमिटेंस इज अगर आप दवाइयों के बिना हो सकते हैं, रिजल्ट्स आपके वही आ रहे हैं लैब में, sugars are not coming high or they're coming within the normal accepted zone without any medicines, तो हम उसे रेमिटेंस कहेंगे. रिवर्सल पर से डायबिटीज के लिए टर्म यूज करना बहुत डिफिकल्ट है बिकॉज वी डोंट सी दैट रियली हैपनिंग. अगर हम लिटरेचर में जाएं तो बेरियाट्रिक सर्जरी वाज वन ऑफ द थिंग्स दैट एक्चुअली कॉज दैट, बट हम फॉलो में देख रहे हैं कि वो भी एक रेमिटेंस ही है, कई बार उसमें भी वापस आ जाती है डायबिटीज. सो राइट टर्म टू यूज दैट फॉर डायबिटीज इज रेमिटेंस, व्हिच यू कैन एक्चुअली डू विद द हेल्प ऑफ experts we have here, obesity experts and wellness consultants. We can actually help you bring down the medicines and that is seen. But trust me sir, the results are far better अगर duration of diabetes थोड़ा shorter है. जैसे आप बता रहे हैं कि 19-18 years की डायबिटीज है तो थोड़ा सा ज़्यादा डिफिकल्ट होगा टू अचीव दैट. बट अगर एक यंग पेशेंट या एक पेशेंट जो बिल्कुल स्टार्टिंग डायबिटीज में आया है, we have seen better results of remittance of diabetes in the typically the first year or let's say up to 2 years of duration of diabetes. Because try and understand, the longer the duration, the pathophysiology has been there, the medicines are there, and the pancreas, the beta cells decline is more likely. Proportional है कि आपके insulin cells उतने ही कम हो गए हैं, and perhaps एक age related factor की वजह से भी एक बहुत phenomenal lifestyle को adopt करना भी थोड़ा challenging हो सकता है. But then there have been results. I mean, it's not that 100% science में कभी भी कुछ 100% नहीं होता. But the right term is remittance. This is what I would tell you, not reversal.
Dr. Paras, I totally agree with that. I think remittance is the right word, just to add to it. And जो आपने एक चीज़ बोली जैसे bariatric surgery में भी या हमने जो देखा बहुत सारे programs में reversal so far हो जाता है. If you follow them long term, तो वो diabetes sooner or later आ जाती है unless you have changed from the whole like certain behavior adaptation. जैसे Chavi had talked and you, Dr. Paras and Dr. Arjun had talked. कि आपको थोड़ा basic modification करना पड़ेगा, but remittance is the absolute right word.
We have a few sensitive questions, but I think we can cover it. Is it correct to use cheap substitute medicines than the costly medicine prescribed by my doctor?
So it's like what
So
exactly?
we can just see that if there is a cheaper substitute, can we go about it?
Yes, as per even if you see the Government of India guideline, Ministry of Health, they recommend the use of generic medicines, provided the manufacturer of that company or whoever is marketing that is able to ensure the quality. Many times we have seen. See, I'm sure obviously in our country, a lot of people are not able to afford the healthcare when they're paying out of pocket. So obviously it's good to have an option of medicines which are available at a fraction of the cost. But for us, it is very important as doctors that the patients are getting what they are prescribed. So sometimes the difference between a generic and probably that would be that if you are prescribing, let's say 2 milligram of a tablet, or let's say 500 milligram of a metformin tablet, patient should be getting that. We are, as doctors or as specialists, we are concerned about the right salt. So if they are able to switch over and get the same results without changing salt content, none of us would have a problem with that. provided that medicine is giving you with that QC, the quality control, what it is intending to. But the results, if I give you the actual experience, what patients have, many patients have asked me in the OPD, sir, can I shift to the generic medicine? I was like, be my guest, please do that. But the results have been sometimes mixed. We do not know the reason why, from where they're procuring it, because in India there is a multitude of people who are providing, whether they're getting it from standard places or not. Because they were on a dose to dose, they shifted from branded to generic medicines. Some people are doing very well. I would say fantastic. Hats off to people who are giving the medicines at that cost. I would, really commend the government of India if they're providing it. But in certain situations, I don't know what the sugars have fluctuated, and the patients have come back themselves and they have realized and told us that no, we are switching back to branded medicines because we had a lot of, so it's subject to the quality control of those medicines. If that can be ensured, there is no problem. So whenever we prescribe, I also mention the salt name of the medicines along with it. In fact, it's a standard practice, and that's why the digitalization of health has also really helped us. In your Tata1mg, if you see, patients are given options that you have another medicine. I'm happy to that. If that medicine is giving the same quality results, please be our guest to switch over. But do not compromise on the salt content and the quality. That's all.
And Dr. Paras, I just wanted I think it's very important to maybe mention in here and just taking cues from what you said. Being transparent with your doctor is what's important.
Yes.
If you think that this is something that you cannot sustain for a long period of time, maybe coming outrightly and mention that can we have something else should be the right way to go about
Yes. They always say never be dishonest with your advocate and your doctor. So it's very important.
I had a question because you mentioned metformin. I think one of the someone had mentioned, and because I belong to a family of diabetics, my dad also does a lot of research. So in one of the healthcare newspapers, it said that metformin is not the best way to proceed, and there are other drugs like I think it's called stigma hydrocalciferol or something, and metformin actually does not suit a lot of people, but that is the most commonly used drugs. So my dad had kind of asked me that why don't you just ask this question on my behalf? He's also watching it.
The answer here is please don't let media decide your treatment. They're really helping you improve your information, but sometimes the headlines and the words which are there in the paragraph, are quite different. So always approach your doctor to really highlight. Metformin is a drug that has been there for more than 60 years. In fact, it is one of the best and the most widely used drug, which actually has properties more than diabetes control. In fact, if you read the history, it was originally not even an anti-diabetic medicine. It is derived from a plant. So it is one of the safest drugs that we have, but which patient is a candidate for which class of drug is entirely to be decided by the diabetes specialist, because every medicine has this property. Every patient can be, most patients are tolerant to most medicines because these medicines are coming after rigid research and market surveys. So most medicines are extremely safe. In fact, I would say all medicines are safe. Safety is the first priority. But yes, individual intolerance can be there to certain patients, which may be due to doses of those medicines, dose related or absolute, where that is where the role of a physician or good diabetologist comes, that they will tweak the medication to give you suitability. But please don't get, flabbergasted or affected by these certain narratives, which are, unnecessarily creating the bad image about a medicine, which is approved by the government as well as the DCGI. So there is nothing wrong with a medicine. It's an extremely safe medicine which has very good benefits. In fact, there are studies that show even it has anti-cancer properties. So that's a minor component, but major thing is if it is suiting you, it's a fantastic drug if prescribed by the doctor within the prescribed level. So there are different medicines. I think we have about 7 or 8 classes of medicines in diabetes today. One size does not fit all. That is another message which patients should know. Please do not replicate the medication of your relative. 2 patients in diabetes are not same. They're not same. Their diabetes is very diverse. It's on a spectrum. The whole goal is to actually optimize you. Okay, so there can be very thin patients who are not good candidates for medicines which are helping you lose weight. You have to optimize to slightly come to the right muscle mass. Then there are very obese patients that have to be brought to a normality. So the goal is to bring everyone to an optimized state. So we use the right medicines accordingly. So whenever even insulin is required, you are told that it will be the right dose for you. So we have to use it very judiciously.
In fact, now that you touched upon insulin, maybe we can take that up. Once started on insulin, is it possible to go back to oral medicines or get it removed from my prescription?
Most common question. So please try and understand in which context the insulin is being used. Now there are different scenarios where insulin is required in a patient. So you need to again see that individual patient who is requiring insulin right now. Please don't correlate that with all patients of diabetes. Okay, One, we talked about type 1 diabetes. A patient who's having type 1 diabetes, typically, or I would say with 100% that needs insulin for life. Because that is a life-saving drug for that. If we did not have insulin today, type 1 diabetic patients would not see the right lifespan which is intended at the time of birth. Then there are other situations which can even come in type 2 diabetic patients course. Suppose patient is presenting with extremely high sugars which the patient has not bothered to treat for a very long time. So like let's say HbA1c is very high. There are guidelines that say above 10, but we see practically even above 14, where the patient is in a sort of state where the glucose levels are so high that the patient is losing weight. And there is possibly a ketone body formation. At that point, insulin is something which is totally lacking in the body. So it could be a temporary period where insulin is required because it will be again lifesaver for the patient, and you will see all diabetes specialists would give the same answer that this patient should be on insulin for now. Yes, perhaps later after 4-5 weeks, insulin would be weaned off because the patient would start resetting that system of manufacturing its own insulin, and then they'll be weaned off. Then there is a third situation where there is a long-standing diabetes. Let's say a patient who is not controlled diabetes very well, and there is a 24-25 year history of diabetes or more than 15 years of diabetes when beta cells have eventually aged. In that case, we see temporally that after a certain escalation of doses, patient is not responding adequately to all the 7-8 classes of medicines that we have, or perhaps this patient is not tolerant to 3 of the classes of the medicines, only other 4 classes are being used in the right safe limits, and now still the glycemic target is not controlled. So these tablets, they work on one basic principle, that there is insulin present in the body. That is what is type 2 diabetes. At that stage, perhaps insulin is required for the patient. And trust me, the earlier you initiate insulin, the first goal, as I said, sir, I think your battle is already won. If your diabetes is controlled, you're already a winner. You're already a winner. So the aim should be that your diabetes is controlled, and if insulin is giving you that control, you're saving yourself from a lot of complications. Whether that insulin will continue for long or not is very individualistic. There have been cases where giving insulin in time has actually led to its discontinuation earlier. So it's not that once it started that it will always be there. Rather, if you delay it more, then the choices will get limited and it will be more difficult to wean you off from insulin. So always follow your doctor's advice.
That's the crux of everything, that you should trust your doctor, and your doctor
Yes.
is your guide when it comes to medicines. I think we can take one more questions, and I have a long list, but we can just distribute this list to specialty wise and theme wise, and then we'll just request your inputs that we can send over to our users later. Okay, so this is, if Mrityunjay has asked from YouTube channel, if BSCR is okay, but BSF is high, 50 point higher, and my age is 73 years, what should I do? Now I just want
What BSF means blood sugar fasting. Right?
I think BSF means blood sugar fasting.
Right.
And what you also mentioned is BSCR.
BSR.
Blood sugar random. I guess it means blood sugar random,
Okay.
or randomly taken anymore. Yeah. So what is the question now?
So if blood sugar random is okay, but BSF is high, 50 point higher, at an age of 73 years, what should I do?
So first of all, the patient should understand at his age what are the normal glycemic goals for this patient. Okay, and for this, let's say 73-year-old, I would say typically a fasting glucose value between 100 to 140 is quite acceptable for him. A random or a post meal value up to 180. Mind you, with this, an HbA1c should also be coming up to 7.2. 7.2% HbA1c is acceptable for this patient. So if all these 3 parameters are met, then we are fine. Then it's all right. Some people can have a little impaired or a little higher fasting glucose, which can sometimes be even slightly higher than the random or post-meal glucose. But if your HbA1c is fine, then we really don't have a problem. We don't increase the medicines because per se it is not harming you. You're still in the safe zone. Plus, another thing, if only fasting sugars are typically coming high in this patient, we also need to see the reasons why the fasting sugars are coming high. They could be spuriously being recorded as incorrect. They may not be actually that high because there are certain reasons that can affect simple things like lack of sleep, simple things like midnight snacking. A lot of people in India have a habit of taking a glass of milk before they sleep. They typically take it at 11 p.m. that helps them sleep. That will offset the fasting sugars because you're not following the strict protocol of about 8, 10 hours, 12 hours of fasting before testing your fasting sugars. That really doesn't mean that this patient has a poor glycemic control. So if your HbA1c is fine, good. In case there is a mismatch, we can also resort to a little 6-point or more frequent blood glucose monitoring. The patient is comfortable, that maybe check the glucose at midnight There can be sometimes midnight lows which can lead to high fasting sugar. The doctor will guide you, or even the use of a CGM technology where we can put a sensor and actually see. I would like to see in this patient how much glycemic variation the patient has. If this patient is maintaining this glucose levels in a very narrow zone, let's say all readings are between 110 to 175, and he has an HbA1c of 6.6, perfectly fine. I would neither increase or reduce the medicine. I would say, sir, you're doing excellently well. Please follow the doctor's advice, whichever you are treating. This is perfect medicine that you're taking. But if there are fluctuations, we need to tackle that.
So I think we spoke about CGMS, and that's where target in range glucose and glycemic variability are very important to be taken care of alongside your fasting, post-meal sugars and HbA1c. With this, I have a lot of questions. क्या मिठाई से diabetes होता है ये सारी चीजें, but I think we can cover this later, and we can just compile all the other questions and send over a note to all of the attendees. With this, I just again want to thank all of you, Chabi, Dr. Paras, Dr. Rajiv, Dr. Meghna, Atika, and Dr. Shalini for joining us in here. And with this, I also wanted to announce, take a bit and just let you all guide to that. After this event, we also have a free retina examination, which Vitro Retinal Society of India, VRSI, Dr. Shalini, Dr. Manisha, Secretary, VRSI, has obliged us with alongside Radical Health. And as Dr. Shalini pointed out, it's a completely painless, non-invasive technique, followed by the screening. There's a post-report review that you can get. So do go and get yourself screened. And we also have a counter wherein you can drop your details if you want any. We are just giving it facility that after dropping your details, our consultant dietitian will give you a call, record your details, and will prescribe you a customized diet plan. So there's another thing. With this, Ashin, we also have refreshments with us, and a few of our teammates is also here. If they just support them if they have certain queries. We are doing a research around diabetes management. So our experts, just in case you have a little more time, and our audience, so if you will have some time, maybe they can spend some time with you. And with this, Ashin, I think we can move on to memento distribution and hamper distribution. We really hope to all the viewers who have joined us online, we really hope that we are able to make some difference in your diabetes journey, making diabetes manageable, a little more doable and followable, and add some value in your diabetes journey. This is just the start. This is just a stepping stone. With Healthcast Begin, we are coming up with many more chapters covering different disease conditions, even symptoms, and other pain points existing in the healthcare space. With this, I would just want to give a closure, and Dr. Rajiv, if you can just please honor all our panelists with a memento and also give us a very quick closing remark.
Sure. No, I think thank you so much, all the fellow panelists, and thank you for coming. Thank you for joining us for this very enlightening session covering all aspects of diabetes. We started very nicely with stress and the overwhelming nature of the disease once one is diagnosed with diabetes, and I've seen it, all of us would have seen that in our personal capacity. From there, we moved on to pathophysiology of diabetes and understood what really it means to be called a diabetes, to going to even digital factors and retinal examinations, and also digital tool, what could really help you to abide by your physician's advice. From there, we moved on to diet as well as habits when it comes to snacking healthy and unhealthy, and very, very pertinent points. Look at the minor cover behind, or the font behind the biscuits and the cookies, not in the front. And from there, we moved on to Dr. Nikla, and we learned about weight management in its core capacity, and in terms of how weight, obesity, and diabetes kind of are interlinked, and ending it on a very, very beautiful note of how we need to move to rest and digest from flight and fright, which is very, very important. And I think super. I think one takeaway, if I have to take and tell our viewers, please try to keep calm and give yourself some time rather than running in the race of life, which is important, yes, but at the same time, you are also very important. So thank you so much. Thank you everyone.